that it is truly effective and safe under the conditions of COVID-19. So there really isn't different. It's just a question of how one feels about it.
Is there any reason to believe it's not safe?
Well, certainly as a drug, any drug, John, has some toxicities. The decades of experience that we have with this drug indicate that the toxicities are rare and they are, in many respects, reversible. What we don't know is when you put it in the context of another disease, whether it's safe. Fundamentally, I think it probably is going to be safe, but I like to prove things first. So it really is a question of not a lot of difference. It's the hope that it will work versus proving that it will work. So I don't see big differences here.
I agree.
Sir, your message to Americans who are working at home, who have their children in their homes right now, who are homeschooling, doctors who say they don't have the masks they need to do their jobs, your message to them?
My message to the American people is that there is a very low incidence of death. You understand that. And we're going to come through this stronger than ever before. If you get it, if you happen to get it, it is highly unlikely. It's looking like it's getting to a number that's much smaller than people originally thought in terms of the ultimate problem, which would be death. My message to the American people is, number one, you've done an incredible job. Incredible what you've gone through. It's been incredible. It wasn't their fault. It wasn't their fault. It wasn't the fault of 140 other countries where this has happened. And there is tremendous hope. And I think we're going to come out stronger, better, bigger in every way. I think we're going to be a better country than we were before. And we learned a lot. And we learned on reliance, who to rely on, who not to rely on. But our country has been incredible, the way they pulled together, including the fact that I just spoke to Senator Schumer. We had a wonderful conversation. We both want to get to a good solution. But it's been really, for me, watching and seeing people that weren't speaking, getting along well, because we all have one common aim, and that's to get rid of this invisible enemy, get rid of it fast, and then go back to the kind of economy that we had, and maybe even better. Yeah, please, in the back. No, in the back, please.
Mr. President, two questions, if you'll indulge me. The first question is, many small businesses are concerned that they have weeks, not months, and are worried about how long it'll take.
We're going to be helping them a lot. We're going to be focused, a big focus, and including my conversation with both Mitch and with Chuck. A big focus of that conversation with small businesses, because they are really the engine behind our country, more so than the big ones. They are the engine behind our country.
Second, if I may, sir, are you concerned about members of Congress that may have used information they learned on updates to sell stocks and profit off of this?
I'm not aware of it. I saw some names. I know all of them. I know everyone mentioned Dianne Feinstein, I guess, and a couple of others. I don't know too much about what it's about, but I find them to all be very honorable people. That's all I know. And they said they did nothing wrong. I find them, the whole group, very honorable people. Yeah, please.
Mr. President, so the whole group would include Richard Burr, the head of the Intelligence Committee, and it also would include Senator Kelly Loeffler. And so the question is whether or not they should be investigated for that behavior.
Well, it also includes Dianne Feinstein, a Democrat. You didn't mention her name. Why didn't you mention her name? And I think she's a very honorable person, by the way. So I'm not saying, but you know, it's interesting that you mentioned two people, but you don't mention one that happens to be a Democrat.
Any senator, should they be
I don't know, because I'd have to look at it, possibly, but I find them to be honorable people. Yeah.
You said the other day you compare yourself, you see yourself as a wartime president right now, leading the country through this pandemic that we're experiencing. Do you really think, going off on Peter, going off on a network is appropriate when the country is going through something like this?
I do, because I think Peter is, I've dealt with Peter for a long time. And I think Peter is not a good journalist when it comes to fairness.
But he's asking for your message to the country.
Oh, I think it's a good message, because I think that the country has to understand that there is indeed, whether we like it or not, and some of the people in this room won't like it, there's a lot of really great news and great journalism, and there's a lot of fake news out there. And I hear it all, and I see it all, and I understand it all because I'm in the midst of it. So when somebody writes a story or does a story on television, and I know it's false, I know it's fake, and when they say they have 15 sources have said, and I know there's no sources, they're just making it up. I know that, and I call Peter out, but I call other people out too. And, this is a time to come together. But coming together is much harder when we have dishonest journalists. It's a very important profession that you're in. It's a profession that I think is incredible. I cherish it. But when people are dishonest, they truly do hurt our country. Yeah, in the back. Please, go ahead.
Mr. President, China has been in communication with the United States and also WHO about coronavirus
Right,
in
that's true.
January.
That's
and
true.
the U.S. shutted its border to travelers from China on February the 2nd. Also, Wuhan has been in lockdown since January the 24th. And this all happened almost 2 months ago. Why did you still say if you could have known it earlier? And also, you have been calling coronavirus.
Well, I have to say this. We have, and I can speak for myself, but I have a very good relationship with China and with President Xi. I have great respect for President Xi. I consider him to be a friend of mine. It's unfortunate that this got out of control. It came from China. It got out of control. Some people are upset. I know President Xi. He loves China. He respects the United States. And I have to say, I respect China greatly, and I respect President Xi. Okay?
You have been calling coronavirus.
Can I ask more about stock buybacks? Many of the airlines and Boeing did stock buybacks. Is this a deal breaker for you in this?
No, but I never liked stock buybacks from their standpoint. When we did a big tax cut, and when they took the money and did buybacks, that's not building a hangar. That's not buying aircraft. That's not doing the kind of things that I want them to do. And we're now talking about buybacks. We didn't think we would have had to restrict it because we thought they would have known better. But they didn't know better. In some cases, not in all cases, obviously. Some people did an incredible job. They built plants all over the country. I mean, you'd see what's happened. I mean, we were doing, until this invisible enemy appeared, we never had an economy like this. But there were some companies that used that money to buy back stock, driving up the price of the stock artificially in many cases. I don't like that. I don't like it. And as far as whether or not we'll have that, allow them, when we give them money, because we have to keep these great companies in business because of the workers, frankly, for the most part, because of the workers. The workers are my number one concern. But the way we take care of the workers is we have to keep the companies going. I am fine with restricting buybacks. In fact, I would demand that there be no stock buybacks. I don't want them taking hundreds of millions of dollars and buying back their stock, because that does nothing. Yeah, please.
Thank you very much. One for Dr. Fauci, and then hopefully one for you.
Sure. And one thing, Secretary of State Pompeo is extremely busy, so if you have any question for him right now, could you do that? Because you know what I'd like to do? I'd like him to go back to the State Department, or as they call it, the Deep State Department. You don't mind? I'd like to have him go back and do his job. So does anybody have any question? Please.
Mr. Secretary, can I ask you want to call somebody? Can I ask what
Yeah, how about you? Only for the
the
Secretary.
exemptions on work travel, can you define that? Is all work, anyone with a work visa can still cross the border? Can you define what, like, the measures that you're taking?
It's a great question. We're working, we're very real concerned about H-2A visas, in particular agricultural workers need to get across. We're going to make sure that we do everything we can to keep that part of our economic lifeblood working between our two countries. DHS and the State Department will work together. We want to make sure and keep commerce between Canada, the United States, and Mexico alive, functional, and prepared for the day that this economy bounces back like we expected it will.
Secretary, Mr. Secretary, the Mexican government has not announced any travel ban on Europe. Where have you been in touch with them as to when they're going to do this and what it is that they're telling you? And then a second question, they also are telling us and said in a press conference this morning that they will not take back any non-Mexican citizen. Any other third parties will have to, we don't know what will happen to them. So can you address what will happen to those third country immigrants that you are saying that will not be allowed to enter the U.S. and Mexico is saying that they will not be allowed to stay in Mexico either or sent back from the U.S.?
If I may, I'll take the first one, and then Chad, I'll give you the second one. With respect to travel into Mexico from outside, I spoke with Foreign Minister Ebrard a couple of times about this. I'm very confident we're going to get to a really good place that protects the Mexican people and the American people from those who might be traveling into places where we've got designations, the Schengen zone from China, so that they're not coming into Mexico and then coming into the United States. I'm very confident we'll do that, and we'll make that announcement shortly together.
Mr. Secretary. And again, as we implement the CDC's order, again, we're going to take a number of individuals that cross the border illegally and repatriate them or remove them quickly back to Mexico, back to the Northern Triangle, and back to any other country. So we're going to do that in a rapid fashion. We'll continue to work with Mexico to make sure that Mexican nationals go back as well as other populations.
But are you sending Guatemalans back to Guatemala or Cubans back to Cuba? What would you do with those third countries that are non-Mexicans?
So we're doing all of the above. We're going to be sending, again, individuals back to Mexico, individuals back to the Northern Triangle countries, Cuba, Haiti, all of the, again, 122 different nations that we see, nationalities that come across that border. We'll be sending them back individually to their countries, but also with working with Mexico to send additional populations back there as well.
And just to put it, when you said before, you said the non-Mexicans going to Mexico. We're not sending them to Mexico. We're sending them back to their own countries, not to Mexico. Why would Mexico take people that aren't from Mexico? We're sending them back. In the case of Guatemala, Honduras, El Salvador, a lot of other countries, they go back to the country from where they came. Okay, and Mike, please.
Secretary Pompeo, on the issue of disinformation, is there any particular locus for this disinformation, or is it diffused?
It's pretty diffused, unfortunately, but we've certainly seen it come from places like China and Russia and Iran, where there are coordinated efforts to disparage what America is doing in an activity to do all the things that President Trump has set in motion here.
Other than what you're doing this morning, what are you doing to fight back?
Lots of things, lots of work. One of the things we want to make sure is the American people go to trusted sources for that information. But we've made clear, we've spoken to these countries directly that that they need to knock it off, that we don't approve of it. And then there are a handful of other things we're engaged in to make sure that the right information is out there and accurate information is given. This idea of transparency and accurate information is very important. It's how we protect American people from something like this ever happening again.
Mr. Secretary, the Peace Corps volunteers.
You want the American people to be coming to trusted sources of information. Does it undermine you at all when the president stands up here and he attacks news outlets calling us untrustworthy?
Somebody else have a question?
Mr. Secretary, the Peace Corps volunteers have the Peace Corps volunteers.
Secretary. In terms of Americans who find themselves stranded in places where there are no longer flights to get back to the United States, what efforts are being made to help them?
I appreciate that question. So we're doing lots of things. We've had a couple places in particular, Peru and Morocco. I think we've had the first 2, maybe 3 now flights out of Morocco. We're going to work to get people back. We're urging individuals when they can get back on their own. They traveled there on their own. When they can get back there on their own, they ought to try to do that. But we have a team stood up at the State Department, the Repatriation Task Force, that is working each of these instances. So we've heard from individuals, members of Congress. We're trying to get Americans back from these places where air travel has been disrupted. And we'll get that done over time. We'll get it done successfully.
Do you have any sense of how big that problem is? Is there any sense of just how big that problem is? How many people?
We don't know the full scale of it yet, but we think we have the largest number identified, and we're working. If there are those who are watching that are someplace, and you can go on the State Department website, you can log into, I think it's step.gov, you can go to STEP and log in, and we'll track it, and we'll try to get everybody back just as best we can.
How long are these border restrictions likely to last along the south and north borders?
They'll last as long as we need to do it to protect the American people from the virus. I couldn't tell you how long it's going to last.
Since we have you determined whether Iran is responsible for that rocket attack last week?
So
maybe we shouldn't say that.
So let me just get back to you on the answer to that. And what we can say with certainty is this: we've made clear all along that the Iraqi Shia militias are funded, trained, equipped by the Iranians, and we've urged the Iranians not to do that, and we've told the Iranians that they will be held responsible for those attacks when they threaten American lives.
The Peace Corps volunteers that are in 60-plus countries, have they all been returned?
I don't know if they're all back or not yet. I know that they were directed to come back. I know that most of them are back. I couldn't tell you if we have all of them back yet.
And then Secretary Esper's not here, but to get tests to the troops in Iraq and Afghanistan, are you able to give us us a progress report on the status of that if they're able to get tests?
I don't know the answer to that. I know we have State Department officials, too, who are concerned, want to make sure we get them tests, our team as well, and we're working on that. We've had significant success on that to date. There are a few places we've not been able to get them, but we will. We'll get them there.
Secretary Pompeo, how exactly are you going to get those Americans back, and do you have any plans to get the military involved in that?
We're going to use all the tools we can. These first efforts are combined commercial, private flights that will fly in, bring them back to a destination here in the United States. So we'll do that. There are some that will travel back other ways as well. And we've worked with the Department of Defense to say where there is space available, we'll be able to bring them back on those flights as well. It's a whole government effort to make sure we get them back. They're going to help us every place they can. Secretary Nesbitt, I've talked about it a couple times.
Thank you, Secretary. Question on Iran again. Is there any consideration to relax some sanctions on Iran during the coronavirus crisis instead of being particularly hard hit?
That's an important question. The whole world should know that humanitarian assistance into Iran is wide open. It's not sanctioned. We've offered to provide assistance to the Iranians as well. I talked with Dr. Tedros from the World Health Organization about this. We're doing everything we can to facilitate both the humanitarian assistance moving in and to make sure that financial transactions connected to that can take place as well. There is no sanction on medicines going to Iran. There's no sanctions on humanitarian assistance going into that country. They've got a terrible problem there, and we want that humanitarian medical healthcare assistance to get to the people of Iran.
But the sanctions themselves, no movement.
We are working to do all the things we've had in place for the first 3 years here to deliver security for the American people.
They know the answer. Iran, they know the answer. Iran, the leaders, they know the answer to your question.
Was it appropriate for the president to call your department the Deep State Department at a time when thousands of diplomats are working very hard around the world to combat this pandemic?
Worked with the president for 3 years now. I know how much he values the people that work on my team. I know when I was the director of the Central Intelligence Agency how much he valued the work we did. I know that he watches our team, Dr. Birx, all the team that's working to push back against this virus to keep America safe. I know how much he values them.
What a good answer. Yes, go ahead.
Mr. President, can I ask a question? Mr. President,
very true, too. Go ahead.
Mr. President,
no, behind you.
I apologize.
Please, go ahead.
The news, I have two questions. The first is to Secretary Pompeo. The NewsHour learned that the CDC picked up that there was some sort of virus happening in Wuhan, the coronavirus happening in Wuhan as early as December. When did the CDC start letting other agencies know that there was something in China happening, that this coronavirus was happening? And then when did the whole government approach start to happen?
So I'll let the CDC or Dr. Fauci, you want to talk to that? Dr. Secretary Azar, please. Yeah.
Yeah, so we were alerted by some discussions that Dr. Redfield, the director of the CDC, had with Chinese colleagues on January 3rd. It's since been known that there may have been cases in December, not that we were alerted in December.
Then, Mr. President, the other question I have for you.
Excuse me, we'll do it in a second. Let Mike,
May I just say one more thing? There's been some discussion about China and what they knew and when they knew it, and I've been very critical. We need to know immediately. The world is entitled to know. The Chinese government was the first to know of this risk to the world, and that puts a special obligation to make sure that the data gets to our scientists, our professionals. This is not about retribution. This matters going forward. We're in a live exercise here to get this right. We need to make sure that even today, the data sets that are available to every country, including data sets that are available to the Chinese Communist Party, are made available to the whole world. It's an imperative to keep people safe. We talk about the absence of data sets, not being able to make judgments about what to do. This is absolutely critical. This transparency, this real-time information sharing isn't about political games or retribution. It's about keeping people safe. And so when you see a delay in information flowing from the Chinese Communist Party to the technical people who we wanted to get into China immediately to assist in this, every moment of delay connected to being able to identify this the risk vectors creates risk to the people all around the world. And so this is why it's not about blaming someone for this. This is about moving forward to make sure that we continue to have the information we need to do our jobs.
Mr. Secretary, what message do you think it sends to other countries when you have the President of the United States lashing out at reporters?
I've had my frustration with reporters too. All I ask when I talk to the media is that you listen to what we say and report it accurately. and it's frustrating. It's frustrating when you see that doesn't happen. It's enormously frustrating. We have a responsibility to tell the American people the truth, and those who are reporting on what it is we're doing and saying have an equal responsibility to report accurately.
What message does it send to countries when you're flashing out reporters?
Really being reported that the news media.
I've seen many things at the State Department be reported wildly and accurately on multiple occasions, and I have spoken to those reporters about it each and every time, and I will continue to do so.
Mr. President, Senator Johnson has suggested.
Well, I'd rather have, if you could finish up with the Secretary of
I
State.
think I've worn him out, Mr. President.
Well, let me
Is
ask
everybody
you both.
finished, Secretary
Let
of
me ask
State?
you both, if that's all right. Mr. Secretary, Senator Johnson has suggested that you and the administration may be overreacting. He said, we don't shut down our economy because tens of thousands of people die on the highways. We don't shut down our economies because tens of thousands of people die from the common flu. At worst, 3.4% of Americans will die from this virus, he said. What do you say to people that have that view? That's 11 million people he's talking about.
Well, I can just say the entire world is agreeing with us because they all have their choice, and everybody's doing the exact same thing. We want to shut it out, and we can do that, and we'll see what happens in 2 weeks and 3 weeks. But if we can save thousands of lives and even millions of lives potentially, you don't know where it goes, but you could be talking about millions of lives. So if you look at the world, I mean, you have some very smart people in the world, you have some smart leaders in the world, and everybody's doing it the way we're doing it. I think we're doing a better job than hopefully most, if not all. We're doing a very effective job, but we'll know better in 14 or 15 days. But, you know, you're talking about hundreds of thousands and maybe more than that, numbers of people. And, you know, we can bring our finances back very quickly. We can't bring the people back.
Mr. President, to follow up on that, there are millions of people out there that share that view, that say, I don't really need to shut things down. I don't really need to stay away from stores. I can go to the beach. And those people making multiple actions exponentially, it's the difference between life and death.
Yeah, I agree with that. But I think I'd like to have Anthony answer that, because to be honest, that's what he does. And we had a lot of very talented people telling us what they think we should do.
Thank you, Mr. President. First of all, I think that's a false equivalency to compare traffic accidents with. I mean, that's totally way out. That's really a false equivalency. When you have something that is new and it's emerging, and you really can't predict totally the impact it's going to have, and you take a look at what's going on in China, and you see what's going on right now in Italy, and what's happening in New York City, I don't think with any moral conscience you could say, why don't we just let it rip and happen and let X percent of the people die? I don't understand that reasoning at all.
Okay, so Secretary of State will be leaving. Any other questions? Go ahead in the back, please. In the back for Mike.
To America. Thank you, Mr. President.
Excuse me, I didn't call on you. Go ahead, please.
Thank you, Mr. President. Two things. In New York, where cases are doubling every day, they fear that supplies are going to run out in a matter of weeks. Yesterday, Mayor Bill de Blasio called on you to mobilize the military to deliver urgent supplies. Yesterday he said, quote, the fate of New York City rests in the hands of one man. He is a New Yorker, and right now he is betraying the city he comes from. I've personally spoken to emergency department nurses who say that they're being told not to wear N95 masks because supplies are so low. So how do you respond to those remarks by Mayor de Blasio?
Well, I just think this.
I'm not dealing, supplies arrive.
I'm not dealing with him. I'm dealing with the governor, and the governor agrees with me, and I agree with him. So far, we've been very much in sync. I guess they're not agreeing with each other necessarily, but the relationship with New York, I love New York. I grew up in New York, as you probably have heard, and the relationship's been very good. And I think government and the governor have been getting along incredibly well with the federal government. Okay.
Question for Secretary Wolf, if I could. Just on illegal entries of people who are OTM, how will the turnback process work? Will they be taken to a common area and then put on a plane and sent back to northern countries or others? I mean, how would that process work?
Again, it's a public health crisis. So what we're trying to do is limit the amount of contact that we have with these individuals, not putting them in Border Patrol facilities, ICE detention facilities, and the like. So it's going to be very rapid. We're going to obviously take them into custody and then send them back to a port of entry or other means. So it'll be very quickly. It won't be the 6 or 7 or 10 days that we currently have. It'll be much more rapid.
But if they are OTM, will they be taken to an airfield
That's
nearby?
correct.
Or?
That's correct.
And sent back over?
Absolutely.
Anybody?
Mr. President, can we ask Mr. President, the checks to Americans, the bill as proposed creates sort of tiers of checks for incomes. Do you believe philosophically that makes sense?
Well, I believe in a lot of things. I want to get workers' money, and whichever way, the best way to get it. And I want to keep the businesses open too, because without the businesses, they're not going to be getting money for very long. But we're going to be talking.
As it's written, is there enough, or do you want to see it juiced up?
If there's not, we'll do something later. I'm sure. I'm sure.
Mr. President, the Wall Street analysts are predicting that unemployment numbers could skyrocket next week. By some analysts, say as many as 3 million people applying for unemployment, which would be a historic number in a 1 week spread. So is a $1,000 check going to cut it? Is that going to be
We're
enough?
not talking about a $1,000 check. We're talking about much more than that. We're also talking about doing phases. If this doesn't work, we're going to keep doing until we get it going. And frankly, once we get the economy back, and once this enemy is defeated, the invisible enemy, as I call it, once it's defeated, we get the economy back, it's going to all come back to us very quickly. It comes back very quickly. We have a tremendous economy. We do numbers like no other country has ever done before. #1 in the world, if you go back 2 weeks, and still, obviously, but if you go back 2 weeks, #1 in the world by far. That money comes back to us very rapidly. We want to keep it. We want to have it so that when we, not if, but when we win the war with the invisible enemy, when we win it, these companies can immediately start. Not that they have to start rebuilding, which takes a long time. Steve?
But you're confident that those are jobs that'll come back if someone applies for unemployment next week?
What projections for job losses in March and April are you hearing?
Well, we're looking at different numbers. We have a best case and a not best case, but the big thing is to defeat the virus. Once that virus is defeated, Steve, I think everything else falls in place very rapidly. I think you're going to have a tremendous upswing. A lot of people agree with me. If you look at your stock market geniuses, and some of whom are not geniuses, but they think they are, a lot of people think that I'm right about that once we defeat the virus, I think you're going to have a very steep, like a rocket ship, it's going to go up, and everything will be back. And I really believe we're going to be stronger than ever before. Yeah, go ahead.
President, on the issue of supplies, you've told governors to try to find whatever supplies they can on their own. But some of them are now saying when they go to try to buy them, they're being outbid by the federal government.
Well, you heard my news conference yesterday.
So what do you expect those governors to do?
That was sort of yesterday's news. No, that does happen because they want to buy supplies. We want to buy as a backup to them in case they can, and sometimes that will happen. But regardless of who gets them, when they need them, we're getting them to them. Now, we're doing the Production Act. We're doing it very much, and we have a lot of things cooking right now at a high level. Remember this, nothing like this has ever happened before. Over 140 countries. And you have supply chains that are broken down for 2 reasons, because they can't supply that much and because people are sick. And they can't be on the chain. So you have a lot of interesting things all over the world. You have supply chains that broke down because of the illness and also because of the quantity. But we're getting it ordered, we're getting it done, and if you just have to look. Some of you were at the call yesterday where I spoke with the governors, almost all of the governors, and every one of them was very impressed with what we've done. Go ahead, in the middle, please.
There are reports saying that the Labor Department has told states not to disclose their unemployment numbers. Do you agree with that decision?
I'd have to talk to him. I would have to talk to him.
Just one more clarifying question, if I could. On the DPA, I just want to be clear. Are you saying that the administration is requiring these industries to create these products, or just asking?
So far we haven't had to. It's an amazing thing that happened. We're getting calls from automobile companies. We're getting calls from other companies saying they have plant capacity. They want to make ventilators. They want to make other things. We are literally being besieged in a beautiful way by companies that want to do the work. They want to do the job. They want to help us. They want to help our country. So we haven't had a problem with that at all.
President, how do you help out states and localities that are trying to bid on things like ventilators and other items that are being outbid by the
Well, when they call us, they let us know. If there's a conflict, they will call us and we will drop our bid because we want them to go first because their point of sale. So we've had 4 or 5 instances where literally that was happening because, you know, we're both trying to get stock. And if we're going against, they will call us. The smart ones, frankly, will call us, and we will immediately, we want them to buy it because it gets to them quicker if they buy it. Okay.
Do they know that
We're really there. They know that, and it's happening more and more where they're calling and they're saying we're bidding against each other. They want to get it. They'll get it much quicker that way. Go ahead, please.
Mr. President, a question for Secretary Azar. There are labs across the country that don't have the testing supplies they need. What specific actions is the administration taking?
I tell you what
Specific actions?
We inherited an obsolete deal, and we made a good thing out of it. I haven't heard that question in a while, but go ahead.
Yeah, so first, we're making tremendous progress in terms of lab testing. Tens of thousands of tests are being done every single day, both through the CDC and the public health labs, as well as now through the private sector commercial labs. They're getting to scale. They have supplies. They have high throughput. We do hear anecdotally occasionally of, say, a public health lab or another one that has a concern about this supply or that supply. Through FEMA, we actually are standing up a laboratory task force to answer those questions. Usually it's that the lab people do not understand that there are actually alternative supplies in the marketplace that they are perfectly free to use. We've actually had to put out some common myths and truths about that. For instance, the other day, we were getting calls from governors saying, we don't have swabs, there are no swabs, there are no swabs. Our supply people went in the open marketplace and bought 200,000 swabs in the open market, and I just sent a letter to every governor sending them swabs. So some of it's just they aren't listening or checking with us about all the freedom, all the capacities out there. It's a complex system with 330 million Americans and all of these labs. So sometimes there's a lab that doesn't understand how much flexibility they have and how much supply there is out there. And we're working through the new FEMA Integration Center to help correct that for folks.
Secretary Azar.
Be happy to how well that's working.
Well, as I said, more and more tests are being performed every day. And as we learn about the results that are being reported around the country of coronavirus tests, our experts continue to look at the numbers and see that some 90% of Americans that are tested do not test positive for the coronavirus. And so it can give you a sense of the magnitude of testing that's going on. We have the number of cases that we've reported today, but it's in some cases near to 10 times that have been tested. But let me also emphasize how important it was in answering these questions for governors and local officials that the President stood up FEMA and the National Response Center, where we briefed governors yesterday. Now, every governor and their state health departments have the ability to reach out to our regional FEMA administrators. And that's how, as the President said, we're sorting out those potential conflicts between very significant federal purchases and procurements and as hospitals and state governments are purchasing as well. I think the new streamlined system operating now in all 50 states and our territories of governors and states going through their regional administrator for FEMA is going to make it more possible for us to ensure that our hospitals, our healthcare providers have access to what's available on the open market and elsewhere.
Mr. Vice President, you're the head of the task force. You've seen the numbers. You've spoken to average Americans. You're a former governor. What do you say to Americans right now who are watching and who are scared?
I would say do not be afraid, be vigilant. All the experts tell us that the risk of serious illness to the average American for the coronavirus is low. But we need every American to put into practice the President's coronavirus guidelines, 15 days to slow the spread, because the coronavirus is about 3 times more contagious than the flu, according to our best estimate, and you can contract the coronavirus, have very mild symptoms, if any, not even be aware that you have it, and expose someone who is vulnerable to a very serious health outcome. That's the reason why we're encouraging people to avoid groups of more than 10, to not eat in restaurants, but to use drive-thrus, to wash their hands on a regular basis. And particularly, we're going to continue, as the President has directed us, to focus on the most vulnerable population, which are seniors with serious underlying health conditions or anyone with an underlying immunodeficiency. It's those people we need to care for, but it's going to take all of us working together to make sure they're safe.
Mr. Vice President, on the issue of ventilators, Mr. Vice President?
Because you just said that you haven't had to require companies to up their production of medical supplies. But you said last night you invoked the DPA. I'm confused.
When we need something, because of the Act, when we need something, we order something. And as you know, 2 days ago, I invoked the Act, which was a big step. I'm not sure that it had been done before, certainly not very much. And when we need something, we will use the Act. What has happened is, before we even go out, many companies, great companies in a totally different business are willing to do things and make things, because that's what they do. They make product. They're willing to make product for us, medical product, that we need very badly for the states, that the states can't get, they haven't been able to get. And you know, most of the states, in no way did they do anything wrong. They were stocked up. They were all equipped. Unfortunately, they've never had a thing like this. So they need help from the federal government.
But you haven't actually directed any this is important. You haven't actually directed any companies to start making more ventilators or masks.
I have, yes. I have.
Many.
A lot. And they're making a lot of ventilators, and they're making a lot of masks. Go ahead, please. Go ahead.
Mr. President, partially following up on that, are there automakers right now who are retooling their production facilities to make ventilators or masks?
I can't say they are, but they will be very shortly, because we're working with one in particular that wants to make ventilators. They called us yesterday, and we're working on a transaction. They're going to make ventilators. They say they've done it before, which surprised me, but they can do it very easily.
Secretary Azar, this is partially for you, partially for Secretary Azar. You said yesterday that you had spoken to Carnival Corporation's chairman.
Yep.
Yes, and he said that he could donate some ships.
No, not donate. That's not the word donate.
Okay, lend.
He's not giving them. He's going to let you use them.
Okay.
I spoke with Mickey Harrison, who's the president, chairman, CEO.
Okay.
And owner.
And he could lend some ships to potentially be hospitals.
He said to me that he was willing to, if we need ships for helping people, that Carnival would be absolutely willing to help us in Los Angeles, in New York, wherever they may be, in Miami, where they're very big. If we needed something, they would be willing to. So far, we haven't needed to, and we're bringing the big hospital ships up in California. We're working with the governor of California, as you know, with Gavin, and we haven't made a determination. We're also talking to folks who would like it in Seattle. So we're discussing where it can be most useful. We've spoken with Governor Cuomo, and we're bringing the big hospital ship up in 2 weeks, and we're going to have it in New York Harbor, someplace in New York Harbor.
So my question is, one, it sounds like you haven't taken them up on it yet, but
no, I have taken them up. I said if we need it, I'll let you know.
Okay.
That's called taking them up.
And secondly,
right now we don't need it.
Ships have a lot of frequently contacted surfaces, and so this is where you come in, Secretary Azar, potentially Dr. Fauci. Do you have concerns about the cruise ships being used as hospitals?
Well, I can tell you they're very clean, and also those surfaces, the germ, as you know, the virus, disappears over a period of time. And these ships are very clean. They've been kept very clean. They've been gone over. But the virus, as you know, if it's on a surface for a certain, they have actually charts, different kinds of surfaces, it disappears over a period of time.
Why not just use hotels?
What are you trying to get at? Go ahead.
Well, that's what I'm asking. Why not just use hotels?
The virus disappears when it's on surface after a certain number of days, or in some cases hours, depending on the surface it's in. Go ahead, please.
Thank you. A quick follow-up. So can you name any of the companies that you've asked to start making these ventilators or face masks?
I will be, but first I want to get the approval from the company, because I don't want to be doing that.
Okay,
I assume they'd like it, but I'll let you know.
Okay, well, thank you. And this is for Dr. Fauci.
One company that has openly stated it is General Motors.
So that's one of the, did the government ask General Motors?
I didn't speak to them about announcing it, but I'll announce it. I'm sure they wouldn't be, but we have others also.
Okay, thank you. And so for Dr. Fauci, there's new research out that the CDC has released that many of the people that that 13% of the people with the coronavirus got it from someone that was asymptomatic. So my question is, does that change the way, the approach that should be taken? And do you think that's the case, or do you think that, or do you not agree with that research?
The recommendations that are here applies to whether you're in physical contact with someone who could be infected with symptoms versus asymptomatic. I don't really think it changes anything. Certainly, there is some degree of asymptomatic transmissibility. It's still not quite clear exactly what that is. But when people focus on that, I think they take their eye off the real ball, which is the things you do will mitigate against getting infected, no matter whether you're near someone who is asymptomatic or not. It's the same thing. Physical separation and the care that's outlined here is going to take care of both of those things.
Thank you, Mr. President. I have a question about testing. When will every American who needs a test get a test and be able to get a test? And why not have medical equipment being shipped right now to hospitals who need it?
You're hearing very positive things about testing, and just so you understand, we don't want every American to go out and get a test. 350 million people. We don't want that. We want people that are that have a problem, that have a problem with they're sneezing, they're sniffling, they don't feel good, they have a temperature. There are a lot of different things. You know them better than I do. So ready? We don't need that. But what we are having is we're having these private labs have come in. They've been really fantastic. And we also have a great system for the future. Because as I said, we inherited, meaning this administration, an obsolete, broken system that wasn't meant for anything like this. Now we have a system that you can see, because look, we're well into this and nobody's even talking about it except for you, which doesn't surprise me.
There are Americans, though, who say that they have symptoms and they can't get tests.
Well, okay.
What do you say to the Americans who are
I'm not hearing it, but we don't want everybody to go out and get a test because there's no reason for it. Yeah.
Americans who have symptoms.
We'll do one more after this.
So I wanted to ask Dr. Fauci, because Kevin Hassett is one of the people who is now suggesting that the real way to get to the end of this, for life to return to normal, is for every single person living in this country to be tested. That way you could see who's contagious, and you could then have people who don't have it go back to work. Is there any possibility that this country could ever get to a point where every single person could be tested, and how long would that take?
Thank you for the question. I've heard that before. I don't connect the dots there. I don't see how testing everybody in the country is going to help you to implement this. This should be implemented universally, at least at this level for everyone. The things we spoke about a while ago, that you want to really ratchet it up, like Governor Newsom is doing in California, like Governor Cuomo is doing in New York, or how you put an end to this outbreak. Testing is important. It would be nice to know, and there are certain things you could do, but let's not conflate testing with the action that we have to take. Whether or not you test, do this. I'm not putting down testing as an important issue, but people seem to link them so much that if you don't have universal testing, you can't respond to the outbreak. You really can.
But I do think, and that's after listening to Tony and everybody else that's an expert, I do think it's important that not everybody be tested. If you feel great and if you have no symptoms whatsoever, it's just not a good thing to be doing. All right, Steve?
A question for Dr. Fauci. Yesterday you mentioned the possibility of aerosol transmission of the virus. How likely is that to happen?
I mean, the possibility of aerosol transmission always comes up when you have situations like that. It comes up with influenza. It came up with SARS, in which there was a documented, one-off episode of some aerosol transmission. Aerosol means that it can stay in the air for a period of time because it's in a droplet that's very small and doesn't go down. Is it possible that there is aerosol transmission? Yeah, it certainly is. But clearly, what we have seen in the situations where people have gotten infected from the areas that we have experienced, China, South Korea, now Europe, most of it is in a situation where people are close enough to each other that a symptomatic person will have a real droplet transmission. So I'm not ruling out the possibility that it's aerosol. But again, it's not going to substantially change doing this.
Dr. Fauci, quick follow-up. Just on the testing issue. Let me just ask this in a very simple way. What is the demand pressure on testing in this country, and are we meeting it?
I get the same calls that many of you get, that someone goes into a place who has a symptom and wants to get a test, and for one reason or other, multiple, logistic, technical, or what have you, they can't get it. That is a reality that is happening now. Is it the same as it was a few weeks ago? Absolutely not, because as the Secretary and others have said, right now that we have the private sector involved, the availability, not only just availability, but the implementation of the availability is getting better and better and better. Having said that, I understand and empathize with the people who rightfully are saying, I'm trying to get a test and I can't.
So is that a way of saying we are not yet at a point where we are meeting the demand pressure?
Well, the answer is yes, John. We are not there yet, because otherwise people would be never calling up saying they can't get a test.
Mr. President?
Well, I just can't emphasize enough about the incredible progress that we have made on testing. All of your reporting, and media outlets around the country are as well, that many, many more tests are being performed every day, literally by the tens of thousands. And this has only been made possible because several weeks ago the president brought in the commercial labs, these enormous companies, Quest and LabCorp, working with companies like Roche and Abbott Laboratories and Thermo Fisher, and said, we have this existing system of state laboratories and the CDC processing tests for certain infections. But given the magnitude of this outbreak, the president apprehended early on that it wouldn't be enough to meet the need. And I just want every American to know that literally hour by hour, in partnership with these extraordinary commercial labs, we are making more and more tests available every day. We'll detail the way that we're working with states to distribute those tests. We've obviously focused on states that have been dealing with the most serious outbreaks of coronavirus: Washington State, California, New York, and others. We've been making sure the tests are in those areas, working closely with those governors. But I think the American people should be encouraged at the progress that we are making. Tomorrow we'll take some time to detail that progress for you, but I would say to any American who might be concerned that they have symptoms, as the president said so well, we don't want every healthy American to get a test. But if people feel that they have symptoms that they identify with the coronavirus, call your doctor. Their doctor can call their state health authorities. They can work very closely with our entire team through HHS and FEMA and work to identify the more and more tests that are available every day.
Just so you know, just for the probably 100th time, this administration, inherited an obsolete, broken, old system that wasn't meant for this. We discarded that system, and we now have a new system that can do millions of people as you need them. But we had to get rid of a broken old system that didn't work. It worked only on a very limited basis. And we're very proud of what we've done. It's incredible what we've done. And this system will
So I don't understand the reluctance to test every American. If, let's say, we tested every American, you'd find out people who are asymptomatic but were in the early stages of having coronavirus, so they should definitely quarantine. On the other hand, you'd find all sorts of people who had the coronavirus and were asymptomatic, didn't know it, and now have immunity. And so they should be out there working, they should be out there volunteering, they should be out there going to restaurants or working in restaurants, working with the public. That would power the economy if everybody could get tested. I don't understand the opposition to everybody get tested, because all sorts of people have the coronavirus right now, are highly contagious but are asymptomatic. Also, many people have had the coronavirus, were asymptomatic, didn't know they have it. Now they have effectively immunity, so they can get out into the world. So that doesn't make any sense to me why you would want to discourage Americans from getting a test unless you simply don't have the testing kits available. So then you should tell the truth, right? In public discussions like this, the primary value should be telling the truth. And so if the truth is, yes, it would greatly benefit the country if everybody could get a test, but we don't have that ability right now, then say that truth. But to go on there, have the president and Dr. Fauci say there's no benefit to everyone getting a test, particularly when Dr. Fauci was asked if people got tested, found out that they'd had it, and now immune, they'd be able to get back to work. And he's just like poo-pooing that. That just makes no sense. So I think that the harsh truth is that we simply don't have the testing kits, the testing facilities, the testing infrastructure, the testing throughput right now to test every American. But to effectively lie about it and say it's not a good thing for healthy people to get tested, that's insane, because so many people who feel healthy right now have the coronavirus and are highly contagious. Also, so many people who are healthy right now have had the coronavirus, were asymptomatic, recovered from it. Now they could get out there into the world, making a difference, powering the economy, patronizing restaurants and bars. This is insane. So I think with public discourse, telling the truth needs to be a top priority, which is why YouTube's restrictive rules against telling the truth are so pernicious, right? We can't tell the truth that different groups have different abilities. There are all sorts of basic truths that we can't say on YouTube. We have to lie either by omission or commission to retain our ability to live stream on YouTube. And the mask story, I think, is symptomatic of this inability of our leaders to tell the truth. And there's a New York Times op-ed March 17 by Dr. Zeynep Tufekci. Don't know how you pronounce it. Professor of information science who specializes in the social effects of technology. Op-ed is titled "Why Telling People They Don't Need Masks Backfired." First, many health experts, including the Surgeon General of the United States, told the public simultaneously that masks weren't necessary for protecting the general public and that healthcare workers needed the dwindling supply. So this contradiction confuses an ordinary listeners. How do these masks magically protect the wearers only and only if they work in a particular field? Second, their attempts to bolster the first message that ordinary people didn't need masks by telling people that masks, especially medical-grade respirator masks, needed proper fitting and that ordinary people without such fitting wouldn't benefit. So this message was also deeply counterproductive. Many people wash their hands wrong, but we don't tell them to not bother washing their hands. Instead, we provide instructions. We post signs in bathrooms. We help people sing songs that time their hand washing. Telling people they can't possibly figure out how to wear a mask properly isn't a winning message. It's also not a truthful message. Besides, when you tell people that something works only if done right, they think they will be the person who does it right, even if everyone else doesn't. Third, of course, masks work. Maybe not perfectly and not all to the same degree, but they do provide some protection. Their use has always been advised as part of the standard response to being around infected people, especially for people who may be vulnerable. World Health Organization officials wear masks during their news briefings. That was the reason I had bought a few in early January. I'd been conducting research in Hong Kong. I'd studied and taught about the sociology of pandemics, and I knew from the SARS experience in 2003 that health officials in many high-risk Asian countries advised wearing masks. Now, of course, masks don't work perfectly. They don't replace hand washing and social distancing, and they do work better if they're fitted properly, of course. Of course, surgical masks don't filter out small viral particles the way medical-grade respirator masks do. However, even surgical masks protect more than not wearing masks at all. We know from flu research that mask wearing helps decrease transmission rates along with frequent hand washing and social distancing. Now that we are facing a respirator mask shortage, the Federal Centers for Disease Control and Prevention recommend that surgical masks are an acceptable alternative for healthcare workers. Again, Obviously, some protection, even if imperfect, is better than no protection. So publicly presenting an absolute answer, you don't need masks, it's just a lie. Then fourth, the World Health Organization, the Centers for Disease Control, told the public to wear masks if they were sick. However, there's increasing evidence of asymptomatic transmission. We don't know who is sick. Many young people have such mild cases, they don't know they're sick and they're still infectious. If everyone was wearing masks, we'd have much less transmission. The World Health Organization, the CDC, say that masks lessen the chances that infected people infect others, and everyone should obviously use masks. The public is told that only sick people should wear masks, and those who do wear them will be stigmatized, and people may well avoid wearing them if it screams, "I'm sick." Further, it's very difficult to get tested right now for coronavirus in the United States, so how are people supposed to know for sure when to mask up? Fifth, places like Hong Kong, Taiwan, and Japan jumped to action early with social distancing and universal mask wearing. They have the pandemic under much greater control than we do. Hong Kong health officials credit universal mask wearing as part of the solution. They recommend universal mask wearing. Taiwan responded to the coronavirus by immediately ramping up mask production. 6, masks are an important signal that it is not business as usual, as well as an act of solidarity. Pandemics require us to change our behavior, our socialization, our hygiene, our work habits, and more collectively. And knowing our fellow citizens are on board is important for all these efforts. Finally, providing top-down guidance filled with such obvious lies backfires because lack of trust is what fuels hoarding and misinformation. Given that there is indeed a mask shortage and that medical workers absolutely do need these masks more, what should the authorities have said? They should have said the full, painful truth. Despite warnings from experts for decades, especially after the near miss of SARS, we still weren't prepared for this pandemic. We did not ramp up domestic production when we could, and now there is a mask shortage. And we could call for people who've hoarded masks to donate some of them to their local medical workers, who would probably work better. That would probably work better than telling people that they don't need them, or that they're simply not smart enough or competent enough to wear them correctly. During disasters, people can show strikingly altruistic behavior, but interventions by authorities backfire if they fuel mistrust by telling all sorts of lies, and wearing inadequate masks are better than wearing no masks. Test, treat, quarantine. Absolutely. That's how we should roll. Then second, I was just thinking the other day, bad news rarely comes on its own, right? It's usually compounded by more bad news. Think about when you've received bad news in your life. Let's say your girlfriend has broken up with you. Then something usually spirals on top of that. Your back goes out. You get sick. You lose your job. A friend stops calling you back, right? Bad things usually compound on top of each other. So now we've got the health crisis with the coronavirus, but of course we're going to have a massive economic dislocation with the gross domestic product going down by something like 10 to 25%. And a sick economy is less positioned to deal with expensive challenges like the coronavirus than a healthy economy. So I just think it's inevitable that there will be more bad news here, right? How often have you experienced bad news and it just comes as a singular occurrence? Usually it's part of a trend. Just as good things tend to come in waves, bad things tend to come in waves. And the way I try to construct my day is to try to build on good things. I get up early, 5:30 a.m. I take that cold shower. So that's a righteous deed right there. I feel invigorated. I feel alive. I feel energized. And then I've already accomplished the most difficult part of my day, that initial cold shower. Then I jump on to a 12-step phone meeting to get my head right, to get my soul right, to connect with other people and to share and to witness other people sharing. Then I talk to my sponsees. I talk to other people in my 12-step program while I'm doing various exercises and various procedures to locate and let go of unnecessary tension in my body so that I'm limber and free and feeling good for the day ahead. I eat breakfast. I only catch up on the news usually about 2 or 3 hours into my day. So the morning is the rudder of the day. So if you try to build good things on top of good things, I get my work done, and then I'm either live streaming or reading a book. so I can feel proud of that. And so I try to be productive the first 12 hours of the day. I try to time track my first 12 hours of the day, trying to build positive decisions on positive decisions. It's very easy when you're dislocated in times of crisis to lose track of how you're spending your time. And as Adam Carolla said yesterday on Tucker Carlson's show, you can either use this time to get a venereal disease, or you can use this time to write a novel. So I can use this time to do good live streams. I can use this time to read books. I can use this time to write, or less optimally, I can use the time to watch Netflix. So try to be productive. For me, the first 12 hours of the day, try to make good decision on top of good decision. First 12 hours of the day, I watch my weight. Every morning I weigh myself. I try to stay under 170 pounds. That also enables me to sleep better. I have less sleep apnea when I can keep my weight down below 170 pounds. And then if I've been making consistently good decisions during the day, come about 12 hours into my day, then I can chill out. Then I can eat dinner. Then I can watch Netflix. Then I can do whatever I want, because I've earned it by using the first 12 hours of my day productively. So I try to build these positive cycles. Just thinking about a definition of maturity that I heard a couple of decades ago. It's about how much volatility can you handle? How much stress can you handle? How much challenge and distress can you deal with without feeling driven to hurt yourself or other people? I think that's a terrific definition of maturity. So some people, they get a little good news or a little bad news, and then they are driven to drink or to Netflix out or to gamble. And other people, they can deal through major difficulties and without lashing out at themselves or others. So that's a favorite definition of mine for maturity. And crises like this show the need to have a prudent reserve, at least 3 months, but probably 6 months. We should have enough money to be able to live for 6 months if all our sources of income just drop off. Shows the need for saving and for prepping. Those of you who went to Prepare with Luke, you're way ahead of the curve, right? Prepare with Luke, for something like $90, you could obtain 3 months supply of food. And so the preppers were onto something. You'd think people would realize by now that you need to have 3 months supply of food and probably a month's supply of water stockpiled for emergencies, in addition to money, in addition to perhaps some precious metals such as silver, which may become currency in a time of panic. Okay.
We don't want to overload our healthcare systems. But what that means is a lot of people, if they're in isolation and staying away, this may prolong the number of cases that we have. It just won't overwhelm us. I think that buys us time. That buys us time to get right medications for this, treatments, and eventually a vaccine. So unfortunately, I think this is going to take a little bit of time.
Okay. We have another viewer question. Someone who writes in and asks, husband and I are both in our 60s with a gym membership. Should we put our membership on hold? We take precautions and wipe things down. Gym has 3,000 members. What do you say, Dr. Mike?
Exercise at home. Before all this happened, I used to think it was very sexy for my couples to work out together, go in the basement, get a...
So a couple of months ago, I was listening to an audiobook by Michael Shermer on conspiracy theories, and he made the point that the world is a more dangerous place than we think about. And so I've been saying that over and over the past 2 months, and now we're in the middle of this unprecedented pandemic. But it just reminds us the world is a more dangerous place than we are consciously aware of. That most of us probably couldn't live with the level of anxiety and fear that we might confront if we had to look at reality square in the face and realize that the world is a more dangerous place than we're usually conscious of. Okay. I was reading this book on Chinatown by Sam Wasson, Wasson. The Big Goodbye, Chinatown and the Last Years of Hollywood. Book came out this year. And Robert Towne started talking to a cop, something like 1970. And he asked the vice cop, "Where do you work?" And he says, "Well, right now we're working in Chinatown." "What do you do there?" "Nothing." "What do you mean nothing?" "Well, that's pretty much what we're told to do in Chinatown is nothing. Because with the different tongs, the different Chinese gangs, the language and everything else, we can't tell whether we're helping somebody commit a crime or prevent one. So we just do nothing." So yeah, get it, Jake. Get it, Jake. It's Chinatown. Good book if you're interested in Hollywood. If you're interested in Roman Polanski and Jack Nicholson and Los Angeles in the late 1960s, early 1970s. So Robert Towne, the screenwriter of Chinatown, he grew up about an hour's drive south of Los Angeles, San Pedro. And he remembered back in 1941, the day he saw the movie Sergeant York. He remembered his shock when Gary Cooper, conscientious objector caught between God and country, finally decides to fight. He remembered the conversation of electrified Americans leaving the theater and the crystal clarity of their convictions. The time this movie came out, most of the audience who saw this movie believed in God, they believed in country. He remembered feeling part of a community, a group of people with shared values. He remembered that sense of moral unity, the notion that some things are not for buying and selling, that feeling that seemed to leave America after World War II, or was it after the Kennedy assassination, or after the murder of Sharon Tate? Increasingly feel that the history of life on Earth is not one of evolution so much as devolution. With each succeeding generation, we get weaker and smaller. The titans are always in the past. Remembering the reactions to Sergeant York, Robert Towne found himself longing not just for the shared American feeling of right and wrong, but for the way of making movies that came from such crisply dramatic distinctions. It's more efficient, a lot easier to tell a story when everybody has shared values. Those days, those values, the belief that an individual's actions actually count for something, those kinds of stories of agency and faith abdicated American minds and movies at precisely the same moment. Something had changed. A golden age had ended. When? Why? So, Robert Towne. For weeks, he just swam in the feeling. He remembered. He sat warm in the sun and walked cool on the shore. He hiked long elevated mountain trails. You read about Los Angeles. And he talked to his buddy, Jack Nicholson. Yeah, pretty good movie there about Chinatown.
Dirty, right? Someone was saying they were filling up their gas tank and she saw someone spray down the actual nozzle with a disinfecting spray. I don't take it that far. I always wash my hands as soon as I get home, as soon as I enter, my workplace. But then I thought, okay, so I fill up at the gas tank. I put those same hands on the steering wheel. I may wash when I go inside and go home, but does that live on the steering wheel, if you will?
It sure can, unfortunately. What I would say is have some hand sanitizer in your car, because those fuel pumps are touched by lots and lots of people. We have a convenience store named Wawa in our area, and they're not allowed now to serve coffee. We used to have a coffee bar. They're not doing that anymore. You have to get it from the employee.
The other thing that rang wrong to me during that news conference today is the president and other people saying Americans should call their doctor. Like, how many Americans have a doctor that they can call? How many Americans have their own personal doctor? Korean man says 100 years from the global pandemic of 2020, a white man will come back knocking on the doors of China, seeking open doors for trade, forgetting all about that coronavirus. Profit at the end of the day was more endearing of a message to many white Americans than race was for the longest time until the recession back in 2008. So how do we feel now about Richard Nixon opening the door to China back in, what was it, 1971? Is that such a great idea now? How do we love all those cheap goods that we get from China? Is it really worth it now? Is it really worth hollowing out our industrial base? Spendrel tweets, if Carl Schmitt were around right now, he'd be getting high off so many states of emergency, states of exception. So a lot of articles out right now about Carl Schmitt. So one of them's in National Review, came out yesterday. Donald Trump was never a Carl Schmitt acolyte. 3 years before the coronavirus arrived, Lawfare published an essay titled Donald Trump's State of Exception. It hadn't arrived yet, the author conceded, and perhaps it never would. But our then president-elect had already exhibited warning signs. Thus, the author's concerned. The state of exception is a concept pioneered by Nazi political theorist Carl Schmitt. It means something like an emergency dictatorship, like what they used to have in ancient Rome, precipitated by a crisis so big and sudden and scary that it demands the suspension of law itself. This, Schmitt thought, was liberalism's Achilles heel. No constitutional order could deal with every possible peril that might befall it. What exceptional measures would then be needed to weather the storm? Only a person could do that. Yes, I would not be surprised if the more authoritarian and socially conformist Northeast Asian countries of Japan, China, South Korea, Taiwan deal with this coronavirus much more effectively than individualist Western democracy. The sovereign then is not the law, but he who decides on the exception to the law. Sovereign is he who decides on the state of exception. Whether the peril is so great that extreme extra constitutional steps are warranted, Carl Schmitt believed they were warranted in the case of Weimar Germany, and during the 1920s he wanted both the Nazi and Communist parties banned. So this worry was that Trump would behave as if there were a crisis when there wasn't one. He would be America's first Schmittian president, a Schmittian without a cause. Well, now there is a real emergency, there is a crisis, there is a state of exception, and Trump has not done a lot about it, much less initiate a state of exception. Yes, he declared an emergency. Yes, he slashed a few regulations. Yes, he regurgitated CDC guidelines. But that's it. The reason that Trump hasn't acted more as a Schmittian sovereign, according to this National Review article, is that he's too narcissistic to flex his muscles when the public good requires it. He is too obsessed with self-image to override a country seemingly hell-bent on suicide. If the coronavirus destroys Trump's presidency, it won't be because of his authoritarian instincts or his contempt for democracy. It will be rather because he indulged the people against their own best interest, what has already proved a self-defeating elevation of markets over men. I'm not suggesting Trump go full authoritarian or that his doing so would be good. And if anything, his incompetence as president speaks against the sagacity of letting him play Caesar. Just saying that if America were to have a Schmittian president, now would be the time. That Trump hasn't jumped at the chance confirms that the real danger of his presidency was never fascism, but fecklessness. Yeah, that's National Review. All right. Cuomo lets no crisis go to waste, so New York Governor Andrew Cuomo has essentially asked everyone but essential workers to stay home. And this article writes, as the German political theorist Carl Schmitt wrote, sovereign is he who decides on the exception. So Carl Schmitt's name getting thrown around a lot in the news. Then 972mag.com, it's a left-wing magazine. Coronavirus coup in broad daylight. As democracy goes into quarantine and surveillance of citizens becomes the norm, Israel is headed straight for an autocracy run by Bibi Netanyahu. The Nazi jurist Carl Schmitt is known for establishing that the sovereign is he who decides on the state of exception. That is, a situation in which the executive power is no longer subject to the law. This is the basis for dictatorship, the clearest contradiction to the liberal worldview that enshrines both separation of powers and checks and balances. The effects of such legal philosophy on the world, and not only in the extreme case of the Nazi regime, are clear to all. When it comes to human rights, there is nothing more dangerous. Well, what about the human right to live? I'd be willing to give up quite a few human rights if we could save lives. But to 972 magazine, there is no combination more lethal than a nationalist government with fascist leanings led by Benjamin Netanyahu. All right, let's go back to predisposed liberals, conservatives, and the biology of political differences.
Slides with numbers on them. This correlation just means that that's a nice solid relationship, a little bit stronger actually than that one that involved just your self-report, whether you survey, in the survey response you said you were discuss sensitive or not. It looks like the physiological thing is working just as well. We broke that down by issues. And then we found something kind of interesting. Notice a lot of those numbers are pretty small, and some are even negative, positive. The little stars, of course, mean something is significant, and that tends to be the bigger numbers. So what's interesting here is that it may be the case that conservatives generally are more discuss sensitive, both physiologically and in surveys, but it looks like it's certain types of issues, especially gay marriage. So in other words, people who responded strongly to pictures of a guy with worms in his mouth, or to a very used toilet, or a cockroach on food, lots of disgusting images. These individuals were also much more likely to oppose gay marriage. And make sure you get that straight, because some people think this means, well, people who think gay sex is disgusting then oppose gay marriage. That would almost be tautological. That's not what we're talking about here. These are just general orientation to lots of disgusting things.
Politico magazine yesterday, coronavirus will change the world permanently. Here's how. Crisis on this scale can reorder society in dramatic ways. Here are 34 big thinkers' predictions for what's to come. Deborah Tennant, author of You're the Only One I Can Tell Inside the Language of Women's Friendships, writes, the personal becomes dangerous. On 9/11, Americans discovered we were vulnerable to calamities we thought only happened in distant lands. 2008 financial crisis taught us we can also suffer the calamities of past eras like the Great Depression. Now, the 1918 flu pandemic is a sudden specter in our lives. This loss of innocence or complacency is a new way of being in the world that we can expect to change our doing in the world. We now know that touching things, being with other people, and breathing the air in an enclosed space can be deadly. How quickly that awareness recedes will be different for different people, but it can never vanish completely for anyone who lived through this year. It could become second nature to recoil from shaking hands or touching our faces. We may all fall heir to society-wide OCD, obsessive-compulsive disorder, as none of us can stop washing our hands. Comfort of being in the presence of others might be replaced by a greater comfort with absence, especially those we don't know intimately. Instead of asking, is there a reason to do this online, we'll be asking, is there any good reason to do this in person? And there's another prediction here, a new kind of patriotism. I would like to reframe it as society starts to value competence over wokeness. Then a return to faith in serious experts. America for several years has become a fundamentally unserious country. This is the luxury afforded to us by peace, affluence, and high levels of consumer technology. We don't have to think about the things that once focused our minds: nuclear war, oil shortages, high unemployment, skyrocketing interest rates. So in many ways, this crisis is tailor-built for men who like to think about the world, because crises like this, they call on us to, one, share our deepest values, our most closely held values, and then combine them with the sources of information that we trust the most. So that's why when you ask a man an opinion, it's a very serious thing that that many women just do blithely. They ask a man his opinion and then they ignore it, or they just treat it as trivial, because when a woman gives an opinion, frequently it's not something that's deeply thought through. But when a man gives his opinion, he is combining his most deeply held values and the sources of information that he trusts the most. So So men who like to think about wider issues right now, this is a particularly exciting time because it's a life and death time, and there's so much uncertainty. So we love the challenge of using our brains, using our values, and using our abilities to ferret out which sources of information we trust versus which sources of information we don't trust. So, for example, I trust Steve Saylor and I trust Greg Cochran. Those are two of my favorite sources of information. I also really like Kyle's takes. I tend to agree with Kyle 95% of the time. So this crisis could force us back to accepting that expertise matters, that competence matters rather than wokeness. And it might return Americans to a new seriousness. Maybe less individualism. Perhaps the coronavirus pandemic marks the end of our romance with market society and hyper-individualism. We may turn toward authoritarianism. Imagine Donald Trump trying to suspend the November election. Consider the prospects of martial law and a military crackdown. Maybe we will reorient our politics, make new investments in public goods for health, especially, and for public services. Religious worship will look different. Plagues drive change. This epidemic has revealed deadly flaws in our healthcare system. Regulatory barriers to online tools will fall. More people will work from home. More people will learn from home. For many college students, returning to an expensive dorm room on a depopulated campus will not be appealing. Many people are learning the difference between having to put on a tie and commute for an hour or two to work in an office versus working efficiently at home. So more people will perhaps work from home. Once companies sort out their remote work policies, it will be harder to deny employees these options. We'll have the rise of telemedicine. This crisis may unleash widespread political support for universal family care or universal socialized medicine. Government may become big pharma. Coronavirus has laid bare the failures of our costly, inefficient, market-based system for developing, researching, and manufacturing medicines and vaccines. We now have an 18-month window before we anticipate widespread vaccine availability to the coronavirus. Maybe science will reign once again. Public respect for expertise in public health and epidemics may be at least partly restored. Perhaps Congress can go virtual. Perhaps big government makes a comeback. Perhaps government service regains its cachet. Perhaps we will have revived trust in certain institutions. Perhaps we'll have a political uprising, an Occupy Wall Street 2.0. Maybe electronic voting goes mainstream. Perhaps election day will become an election month. Voting by mail may become the new norm. Maybe we'll have more restraints on mass consumption when we see the externalities to, for example, buying all sorts of cheap goods from China. Maybe we'll start, it seems to me right now that we should be imposing a $500 tax on international plane travel given the dangerous externalities. We will develop stronger domestic supply chains. And it seems like the inequality gap will widen. We'll have increased appetite for diversion. We will seek to obtain relief from stress by pursuing pleasure. We'll have less communal dining and more at-home cooking. And a lot of habits will be smashed. So when some habits are smashed, maybe new ones will be developed. In the novel The Plague, Albert Camus writes, "The truth is everyone is bored and devotes himself to cultivating habits." Maybe you'll take the dual specters of autocracy and disease to get us to listen to our common sense, our imaginations, our eccentricities, and not our programming. Okay. Get back to this lecture here. Predisposed, liberals, conservatives, and the biology of political differences.
That don't have anything to do with gay sex. So this is the final one, I think, with numbers. And I just wanted to point out what's kind of interesting to me is that the self-report that you do in a survey, that does make a difference. And the physiological stuff makes a difference in terms of explaining your position on gay marriage. Those two aren't related to each other at all, though. So people who say, I would never drink soup that had been stirred with a fly swatter, are not the same ones who are reacting strongly physiologically, which I think is kind of interesting. But what is even more fascinating to me is that both are relevant. So how you conceive of yourself in terms of disgust sensitivity and how you actually respond in a physiological sense, both are important. So I like to say this because some political scientists don't really like our research because they're really locked into the survey methodology. We need to ask people about this and that. And this shows that those things are still important. Keep doing the surveys. But maybe we're missing something if we don't do the physiological tests as well. We've broadened this out beyond just disgust. And so we show them just general pictures that are negative or positive. The lady skiing is one that reacts very positively. People like that idea of having a good time, embracing cold conditions. Things like houses on fire and other things are viewed as negative. So what we did was we measured the physiological response to positive and negative images. Of course, psychologists sometimes can't use simple words, so we use aversive for negative and appetitive for positive. What's interesting here, though, is that, as you can see, liberals have a pretty similar physiological response, whether those images are positive, like the lady skiing, or negative, like the house on fire. But then you look at conservatives, and you see a much stronger response to the negative things than to the positive things. Conservatives simply are more physiologically aroused by something that is not pleasant. This is another way to view it. If you don't like numbers,
So let's talk about the real. Our reality is constructed by a combination of language, symbols, media, history, culture, and everyday experiences, but this constructed reality is quite different from the real. I'm reading from an essay, Been Through the Desert on a Horse with No Name, in the book Breaking Bad and Philosophy, Badder Living Through Chemistry. It's a collection of essays. So we tend to insulate ourselves from reality by our own ideas, perceptions, and constructions of reality that act as a layer, a buffer, or a veil, as a mask between us and what is real. And real takes the form of death, traumatic events like the coronavirus, horrible experiences, as well as ecstatic experiences, positive interactions, and highly memorable events. Constructed reality is a defense mechanism that most of us erect so as not to be crushed by the various harsh and lifeless aspects and manifestations of the real. But we have our constructions of reality, and then it gets run into by things like the coronavirus. So, for example, you may have a middle-class white male tourist in a major city accidentally walks into a neighborhood dominated by ethnic minorities. He may come into contact with a group of young males listening to gangster rap, talking in a lingo that he doesn't understand. To the tourist, whose constructed reality to that point didn't contain gangster rap and the like, the whole incident seems surreal, perhaps even threatening, but this is the real, puncturing or interrupting his constructed middle-class white reality. The difference then between our constructed reality and the real affects how surreal the eruption can be. The real has a habit of disturbing and disrupting us. It subverts our constructions and our perceptions of reality, our lived everyday experiences of life. These disruptions can be harsh, they can be lifeless like the desert. The everyday constructed reality that Walter White had prior to Breaking Bad was monotonous and predictable. But then he came in contact with the real, that he was going to die soon from lung cancer. You can also call the real hyper-reality. So the real often displays characteristics that are attributed to the surreal. and these can make one faint and unbalanced. So the real breaks through, it disrupts, it shocks and surprises us, it burrows into the edifices of our constructions of reality that we have built for ourselves. So throughout Breaking Bad, these instances of burrowing into our constructions of reality provide the catalyst for the changes in the narrative. They are the instances of conflict, suspense, and drama. Our constructed realities shift all the time. Constructed reality is made up of language, symbols, signs, and experiences. So our realities are coded and recoded on a continual basis. Words operate as metaphors for reality. As the real penetrates, our inbuilt coping mechanisms will sometimes fail. And then our defenses are broken down, and we can collapse, and we can collapse quickly and rebuild quickly, or we can collapse permanently. So when Walter White got into trouble cooking meth, he could have come clean, admitted to his crimes, and faced the consequences, but he chooses instead to keep on cooking meth. So the degradation of his life into criminality continues. The real begins to interject into his conceptions of reality. It overtakes him, and it alters his reality and those of people around him. And as Walter White continues to cook meth, he commits more and more crimes. Once you realize that your reality is constructed, and that beyond your construction of reality there exists the real, or the hyper-real, beyond your constructions, you've achieved a kind of nirvana state of awareness of your true self. For Walt, it may be that his true self is Heisenberg's tendencies for criminality and a more subversive lifestyle. For instance, Walter White's reinvigorated sex drive correlates with his cooking of meth. Walt's reality is still very much constructed by his family relationships. His conscious justification of his meth cooking is that it'll help him obtain the medical treatments he needs to recover. When Walter White meets the ruthless drug lord Tuco, this was his encounter with the hyper-real. His journey into the desert of the real is now no longer under the motivation of his own unconscious desires for illegality, but it's more than that. The real is ultimately indescribable and undecipherable. It exists beyond our constructed realities, which are constantly adjusting. Reality adjusts through the variation in our language and symbols in accordance with our encounters with the real. So for Walt, he has to tell more and more lies to keep his constructions of reality in place. Philosophers who discuss the real point out that it's never experienced directly. Not necessarily true. Traumatic encounters have a way of shattering our constructions of reality. The real has a raw power that can shift the realities that we surround ourselves with. Such trauma is often large scale. The aftermath of 9/11, many people talked about the event as the exposure to the real, as our constructions of reality fail to cope with such a cataclysmic event. So events like the coronavirus hit home with the harshness and the lifelessness of the real, and the reality that death is often just around the corner. For Walt, the trauma isn't a singular event, but more of a continual attack by the real on his constructions of reality. As his understanding, his sense of reality fails, he has to reconstruct his sense of reality in different ways, so he's continually altering his understanding of reality as well as the realities of his family and friends. The real has altered Walt's constructions of reality to such a degree that he has changed irrevocably. His reality and all that entails, his relationships, his behavior, his language, and his experience have shifted to reflect the real. Walt has shifted from being a family man to becoming his alter ego, Heisenberg. He realizes that the real is unavoidable. That's why he advises Hank, the DEA agent, after his close shave with an exploded tortoise, to get up, get out in the real world, and you kick that bastard as hard as you can, right in the teeth. Walt's constructed reality has changed forever. Through Walter White, in the TV show Breaking Bad, we see that the real is a philosophical concept that's more than unconscious desire. It's not even what could be considered fate or destiny. The real is an existence that can't be experienced or sensed. It can't even really be referred to as an it. We construct realities based on the whole range of emotions, experiences, memories, and idiosyncrasies that pervade our everyday lives. But when we encounter events, traumas, or other interruptions that shake our constructions of reality, we are exposed to the harshness and lifelessness of the real. That's why we call this exposure desert-like. But the desert metaphor is just that, a metaphor for an ultimately unexperienceable reality. The seismic shifts we experience in our own constructed realities are more jarring than the daily fluctuations in our realities, but they have no less transformative effect. Breaking Bad shows just how realities change in response to an exposure to the real. Walter White's journey into the desert of the real is a series of traumatic and disruptive events that shifts his reality from a family man with a steady teaching job to drug lord. The ways constructed reality continually change through interruptions of the real, not just for Walt, but for the other characters as well. It's what makes Breaking Bad a great TV show, to express this philosophically rich idea. We construct our own realities around our daily lives and experiences, but they will be at times disrupted by the real. So when the real comes crashing in, will we, like Walter White, decide to break bad?
I had my graduate students, I think we showed them 36 or 38 images, and I said, identify the three where the liberals have the largest skin conductance response. And you can see it's a happy kid, a biracial kiss, and a very nice fruit display. That's what really got liberals going. Look what gets conservatives going. A physical altercation, a verbal altercation, and then a spider on the face. So the point here is this is, very different kinds of things that are physiologically arousing to liberals and to conservatives. You can go beyond the physiology to look at what people pay attention to. And here we use a device called an eye tracker, which I'm sure some of you are familiar with. They're used commonly in commercial applications to see where on a screen you're looking, so they know where to put the tickers and who knows what, so you buy more. We're using it for an academic purpose. We just like to know what people are paying attention to. So in this case, we can't have just one image at a time. We create these collages of 4 different images in 4 quadrants. Yeah, I warned you that there were a few disgusting images. So here we have 3 positive images. For most people, the giraffe, the angel, and the chocolate chip cookie are positive, whereas the fellow, I guess, losing his cookies, or probably losing Jägermeister or something, that's not favorable. Similar, here we have 3 negative and 1 positive. So the beach ball rates very positively in objective evaluations, and the wrecked car and the used toilet do not. So what we'd like to know is, where do people spend their time looking when they're given this option? So we put the eye tracker on and we have them look at this for 8 seconds. And here we find that, well, first of all, everybody has a little bit of a negativity bias or an aversive bias. Our eyes tend to be drawn toward the negative things more than the positive. But what we see is the degree to which that's true varies widely from liberals to conservatives. Liberals do, because that bar is positive, that does mean liberals look at the negative a little bit more. But it's only 0.04 of a second, 400 milliseconds is what that amounts to. Conservatives have an aversion bias or a negativity bias of about 1,600 milliseconds. So the difference is 1.2 seconds. That may not sound like a lot, but those people who specialize in eye tracking say that this is an eternity. And I'm not a specialist, but I was very pleased that they said that. So it does appear as though conservatives are responding more physiologically and paying more attention to things that are threatening, dangerous, disgusting, or just unpleasant.
Yeah, this is from the 2014 book Predisposed, Liberals, Conservatives, and the Biology of Political Differences, looking at the BBC. The Chancellor says the government will step in and pay people's wages. Tim Stanley, leader writer for the Daily Telegraph, tweets, incredible, politics will never be the same again. Classical liberalism has just gone into the study with a revolver. Galician says not much will change as a result of the coronavirus because human nature doesn't change. Nothing changed after the global financial crash. Scott Ritter, the weapons inspector who warned about the folly of invading Iraq in 2003, tweets this morning, the absolute failure of the establishment to have a plan for responding to systemic supply chain disruption in the age of globalism brought on by the coronavirus pandemic is a sign that this problem won't be solved by politics as usual, but rather by a nonconformist like Trump. Vida tweets, when will the corporate media publish a story bemoaning how the China virus will only further help the rise of the radical right in Europe and break the back of post-World War II liberalism for good? And a friend imitates Donald Trump. The growth of the coronavirus the past 2 days has been tremendous. I mean, really great, really tremendous, just great growth. David Pinson tweets, coronavirus is proving the entire neoliberal elite consensus was harmful. James Miller tweets, should we use geoengineering to raise the Earth's average temperature for a year or so to fight the coronavirus? Peter Kolczynski, virologist, tweets, I'm hearing people say it's impossible to make a coronavirus vaccine because we haven't been able to make one to any coronavirus. Not true. We have veterinary vaccines for dogs and cow strains. Humans have not been investment worthy until now. There are 4 coronavirus strains that circulate among people, causing nothing more than mild colds in most people. They stimulate a modest immune response, enough to get over an infection and leave you protected for about a year, maybe more. But eventually the antibodies wane. That's when you become susceptible to reinfection by the same virus. So why haven't we developed a vaccine against these 4 coronavirus strains? We could take it every year and protect ourselves against colds, right? But nice idea. Most colds are caused by other viruses. Our 4 standard human coronaviruses only cause 20% of colds. Colds are mostly caused by rhinoviruses and parainfluenza virus and other viruses we haven't identified yet. They are also different, that each would require a different vaccine. So while we could have made a coronavirus vaccine, which would have had to have been 4 vaccines, 1 for each strain, trouble is that would have only helped protect us against 20% of the viruses that cause colds. It'd be difficult and expensive to run a clinical trial that showed that the coronavirus vaccine worked, because even if it reduced your risk of suffering by a coronavirus by 75%, that would cut the risk of any cold by only 15%. It would be a large trial, so this 15% reduction would be statistically significant. It's doable. The bigger problem is the marketing message of 15%. Adults get 2 to 4 colds a year, so a 15% reduction doesn't add up to even 1 fewer cold per year. Not very compelling, right? The commercial product people want is not a coronavirus common cold vaccine. They want a common cold vaccine that protects them against most of their risk. Vaccine that would protect against most cold viruses, and we don't even know what causes 30% of colds. Some viruses require vaccines to have multiple components to be effective. All these components would require their own development and optimization. We're not talking about inventing one product. We're talking about inventing over a dozen each, which would be useless alone, but all of which would be needed just to get maybe a commercially viable product that people would maybe want to take. Because 1, it's just a cold. 2, your insurance would probably make you pay a copay to nudge you into not taking it. 3, people have needles. People hate needles. As the Lyme vaccine developed and launched and then was pulled off the market after a few years for the reasons I just listed, and we really need a Lyme vaccine because ticks are spreading and carrying a host of horrors, but that's a slower, quieter pandemic. Coronavirus is different. It's more serious, more so than the flu. So we will develop a vaccine for it, just as we have for the flu and for dog and cow versions of coronaviruses. Might cost a few $1 billion across a dozen different programs, but there will be a market. Companies will compete on price and still make billions a year. Supplying the world with a constantly evolving yet affordable flu vaccine usually costs $10 to $20 each. Maybe mix it in with the annual flu shot for convenience. I've heard people say that the industry doesn't care to make a universal flu vaccine. That's not true. There have been efforts and investors willing to fund credible projects, but it is hard. Despite decades of failure, there are still biotech companies toiling on a universal flu vaccine, which would protect us against most strains of the flu with one shot every 5 to 10 years. It's hard, but doable. By comparison, coronavirus is simple. It's definitely not herpes. Coronavirus is so technically durable. We already have vaccines for dog and cow coronaviruses. We'll definitely make one for humans. Insurance will pay for it just as it does for the flu vaccines, most cases without a copay. Back to discussion here on predisposed liberals, conservatives, and the biology of political differences.
Finally, we took to this approach to what we call the next level, simply because it's extremely expensive. But we did some fMRI scans of individuals who were looking at either, disgusting images or neutral images. And I thought I'd give you one example of a neutral image. It's like a wastebasket or a pencil or a toaster, just things that really don't have much pizzazz from a physiological point of view. We did 2 separate studies. In one case, we showed each of these images for 4 seconds, so that's a nice period of time. In the other case, though, we showed it for 16.5 milliseconds. And here again, we're to the subliminal range. You cannot see anything in 16 milliseconds. It's much too fast. So it would look like kind of a stutter on the screen if I would be able to show that to you. You have no idea what you've seen. So here, this shows that one was for 4,000 milliseconds and one for 16.5, 2 different experiments. Now this picture is a little bit confusing. I know it's hard to get a lot out of imaging pictures unless we spend some time talking about what's what. But the yellow reddish kinds of areas are the areas of the brain where liberals and conservatives were different during the 4-second view. You can see that some of these are higher up in the brain. DLPFC stands for dorsal lateral prefrontal cortex. SMA is a supplemental motor area, so you might have been getting ready to move away from this disgusting thing. But then the bluish areas down lower are the differences that appeared between liberals and conservatives at 16.5 milliseconds. And I'm really proud of this. I think it's astounding that we're getting differences between liberals and conservatives when they're looking at disgusting as opposed to neutral images when they're not really looking at it. They don't know that they've seen it. It happens much too quickly for that. So it's just flashing up there, and still we get a difference. So I guess I'm proud of this because it suggests to me that this is very deep. It's not something that you can kind of think about.
Okay, looking at the Drudge Report right now, the UK is shutting down pubs, restaurants, leisure centres, closing nationwide tonight because of the coronavirus. The Fed is now buying municipal bonds. California predicts that more than half of its population will be infected. California is essentially on lockdown, except for essential workers. Everyone else is being told to stay home. Testing chaos continues. Jobless claims may reach over 2 million next week. Newly unemployed are having to grapple with the fallout. Virus is killing far more men than women. Netflix and YouTube have reduced resolution so that they don't crush the internet. Internet traffic is surging, but the pipes aren't bursting. Power industry may ask staff to live on site. An NBC News staffer is dead. American Airlines has ground 55,000 flights. Delta and United are sending their largest planes to the desert for storage. People are flocking to the safety of comfort foods. Meat industry braces for disruptions from ill workers. New York now under a state lockdown except for essential workers. Goldman predicts a decline of 24% in the GDP. An Italian virologist says the country's attempt to not appear racist in the early days of the coronavirus outbreak crippled Italy's ability to properly respond to the pandemic. Political correctness proves deadly once again. Another name for political correctness is that you're not allowed to say the truth. Jeffrey Miller tweets, if the United States does not do a serious lockdown for 3 to 7 weeks, we are facing a calamity with millions dead. We try a shorter, half-assed lockdown of, say, 2 weeks to just save the economy. We doom too many people and the economy collapses anyway. So we're looking at a lockdown between 3 to 7 weeks. Now, we wouldn't have to do a lockdown if we could just test everybody. Mark Krikorian tweets, considering the trillions of dollars the Wuhan virus response is going to end up costing us, will we, in the end, actually have saved any money by offshoring so much of our manufacturing to China?
It may happen when you think about it, but it happens even before you have a chance to think about it or see it. So let's move toward a conclusion here. My pitch is that people differ in the way they see and experience the world, and these differences affect their politics, not surprisingly. You can put this in a pejorative sense, as I have done here, which I don't like to do, that liberals see the world through rose-colored glasses, whereas conservatives see the world through fear goggles. I would rather we not use labels like that, because my big pitch here is that we need to view these biological differences as something other than failings. We need to view our opponents as not being morally or intellectually deficient necessarily. I mean, they might be, but it may be that they're just different, and I think we need to recognize that. As I say here, again, they may simply experience and respond to identical stimuli in very different fashions. I don't know if you've ever had the experience of watching a political debate or something with someone who has different views than you, and it's like, wow, did we really see the same debate? You know, and part of that is just that our approaches to the world are very different, and this happens at a deep level. So why would this be important? I mean, who really cares? Well, you know, the history of the world is such that traits that are known to be biological are usually tolerated more. I mean, think of what happened with handedness. My dad was left-handed, and I'm sure he's exaggerated these stories, but he tells me how he was slapped on the hand with a ruler whenever he'd write because the teacher thought this was just a habit and he was being lazy and they needed to shape up. Well, now we know that handedness is very deeply biological. When we do our brain imaging work, we have to screen out people who are either left-handed or right-handed. We can't have a mix. It's got to be one or the other because the brain differences are so great. Well, that suggests it is indeed very deeply biological. Mental challenges. Here's a fellow with Down syndrome. You know, we used to think that mental problems came because of bad parenting or demonic possession, and generations of people felt guilty when they shouldn't have felt that way at all. Now we have a much better attitude for this. We recognize that there is a biological element to mental challenges. Sexual orientation is, of course, the one that most people talk about these days. And it's a statistical fact that those people who believe sexual orientation is biologically based are more tolerant of diverse sexual orientations than those people who believe it's simply environmental, and that all we need to do is, send them to boot camp or do something. That if we change the environment, we'll change the sexual orientation. So the point here is that usually those people who believe that things are biologically based are going to be more tolerant of variations in those things. And I think the same thing would happen with politics. So, our friends James Carville and Mary Madeline.
Okay, there's James Carville, Mary Madeline. Mary Madeline ran the atrocious 1992 George H.W. Bush campaign, and James Carville ran Clinton's 92 and possibly 96 campaigns, married to each other. Looking at friends' comments, for all the critiques I may have of the Americans, that the Russians, the Chinese, and the Iranians have not been able to come up with a credible alternative to the US dollar is pathetic. When it comes to the euro, well, that would be a complete S show whenever it goes tits up. There's just an insane demand for US dollars worldwide because it's money good all over the planet. The rest of them are just local currencies for specific nations. The dollar is backed by the rule of law and with legal recourse in a credible court system. And here's some highlights from this book, Predisposed: Liberals, Conservatives, and the Biology of Political Differences. In this book, we aim to explain why people experience and interpret the political world so very differently. We want to provide liberals with a better appreciation of the conservative mindset, conservatives with a better appreciation of the liberal mindset, and moderates with a better appreciation for why those closer to the extremes make such a big fuss. A few years ago, we published a study showing that liberals and conservatives experience the world differently, suggested that it might be unproductive and inaccurate to view either side as irredeemably malevolent or unremittingly beneficent. We received numerous emails after media coverage of this study. Some of these were decidedly caustic. but the more memorable ones were plaintive rather than judgmental. His key line was, "Don't do this to me, I need to hate conservatives." For some, it is deeply rewarding to denounce one's political adversaries, preferably at high volume. "You're not outraged, you're not paying attention," goes the old saying. We disagree. Outrage does not solve challenging issues of governance, and it is possible for people to pay close attention to politics without losing emotional control. A more productive, if less viscerally satisfying response to political difference is to try to understand the source of the views of those who disagree with us so fundamentally. To illustrate the value of entering the mindset of the other side, consider the following example. One of our children was given to horrible nightmares. He would cry and shout as monsters circled in his sleep. Words from the awake world, "There is no monster under your bed," could not disabuse him of the fears that were so real to him. Weeks into this unpleasant pattern, due more to desperation than inspiration, his parents' strategy changed. Instead of telling him how silly and outrageous he was being, they entered into his dream world. Yes, there is a monster. Yes, he is an ugly one, and he's mean, and he is coming this way. But wait, he just spotted some monster friends of his, and he's moving off in another direction, way off. By imagining the world the child was in, by letting him know that others understood the nature of that world, it became possible to work through the attending issues. Blissful sleep for parents and child alike soon descended where monsters had only lurked moments before. In this book, we make the case that political variations are part of an incredible range of differences in the way people respond to the world. Turns out that liberals and conservatives have different tastes, not just in politics, but in art, humor, food, life, accoutrement, and leisure pursuits. They differ in how they collect information, how they think, how they view other people and events. They have different neural architecture and display distinct brainwaves in certain circumstances. They have different personalities and psychological tendencies. They differ in what their autonomic nervous systems are attuned to. They are aroused by and pay attention to different stimuli. They might even be different genetically. At least at the far ends of the ideological spectrum, liberals and conservatives are emotionally, preferentially, psychologically, and biologically distinct.
A fascinating case. Everybody wonders how they can do it. How can two people with such very different sets of political beliefs get along? And I think one of the interesting things about them is, if you've ever heard interviews where they're asked those kinds of questions, they say, well, the truth of the matter is we do not discuss politics at home. It wouldn't work. In fact, in the one interview I saw, they said there have been two very dark periods in our marriage, and those were periods when politics was just so salient in American life that we couldn't ignore it. And we talked about it. I think it was Bush v. Gore, the whole post-2000, and then the Iraq War. And they said this almost ended our marriage. But other than that, we go about our business. We respect the other person. They're just very different. We're not going to try to spend our lives persuading the other person that they're wrong about their political beliefs, because they simply wouldn't get very far. So we need to accept this. Name calling is not going to be helpful, whether if it's in a spousal situation or in a situation more broader than that. Thus, I would suggest that books such as Ann Coulter's, if Democrats had any brains, they'd be Republicans. That's not very helpful, but neither is Al Franken's, who says that people on the right are simply liars or lying liars who tell lies. So this suggests that it's either an intellectual failing, as Coulter says, or a moral failing, as Al Franken would have it. So we're pushing a middle ground, and that's not nearly as intriguing or as soothing to people.
Okay, so what's going on right now? We have stock market is down 2.5%. It's down 464 points. Crude oil is down, suddenly down 15%, down to $21 per barrel. New York, California tighten restrictions, global deaths top 10,000. And we have the UK shutting down. California, New York.
California orders a lockdown for the state's 40 million residents. The Senate introduces a new stimulus package that includes checks to Americans. And Walmart says it will hire workers and boost pay to meet surging demand for food and household essentials. Here's what you need to know today.
We direct a statewide order for people to stay at home.
California ordered its 40 million residents to stay at home to curb the spread of the coronavirus. People are only allowed out for essentials like groceries. The largest lockdown in the U.S. began Thursday night. Newsom estimates 56% of the state's population could be infected over an 8-week period. The nation's total number of coronavirus cases has now surpassed 14,000. The total number of deaths from the coronavirus across the world has exceeded a milestone of 10,000, with Italy's death toll surpassing China's on Thursday. The State Department has urged U.S. citizens who are abroad to return home.
The American people need help, and they need it fast. This will deliver it.
Americans could receive up to $1,200 in direct cash payments as part of a stimulus plan introduced by the Republican senators to fight the impact of the pandemic. Married couples would be eligible to receive as much as $2,400, with an additional $500 for every child. Those payments will scale down for individuals who make more than $75,000 and couples that make more than $150,000. The proposal needs the support of Democrats before heading to President Trump's desk. Stocks and currencies bounced back early on Friday after the Fed said it would help lend billions of dollars at near-zero interest rates to central banks around the world. However, investors say it's too soon to tell if the Fed's actions could ease the global turmoil. Walmart plans to pay special cash bonuses totaling $550 million to its hourly workers and hire 150,000 temporary staffers. The company has struggled to keep its stores stocked and fulfill online orders as shoppers stock up on food and household essentials amid the pandemic. This comes as many states, including New York and Connecticut, see a spike in layoffs.
Italy reported 627 fatalities on Friday. Now, one reason that Italy has so many fatalities is that it is reporting all deaths by people with coronavirus. They're attributing them to coronavirus, while Germany has a much more restrictive basis for attributing a death to coronavirus. So anyway, 627 fatalities Friday is the world's highest number of deaths in a day. Italy's total death toll now stands at 4,032, the most of any country. In the United States, deaths from the pneumonia-causing pathogen have more than quadrupled over the past week to 210. Confirmed infections have surged to 14,000 from just 1,700 a week ago. The majority of U.S. cases exist in 3 states: New York, Washington, California. New York accounts for about 40% of all cases. So Andrew Cuomo, the governor of New York, has ordered New York residents to stay indoors and requires all non-essential workforce employees to stay home. New York has 7,102 infections. Then Wall Street Journal article here: gig worker balances big paydays against coronavirus risks. His deliveries include constant texting with customers hauling 12-packs onto the bus. Is it worth being exposed for a $20 tip? His best day as a gig worker was a 344 haul he notched last year. Last Friday, he nearly doubled that tally, followed up with another 602 over the weekend. He delivers for Ship, which is a Target corporation. He gets paid per delivery plus tips. He's a Yale University and Seminary graduate with a part-time job. He uses his Ship income to pay off more than $200,000 in student debt and to keep up with healthcare premiums and other bills. Lessons for the coronavirus from 6 other disasters from the Wall Street Journal. First, governments and the public always face a trade-off between economic stability and public health and safety. The more you prioritize health and safety, the bigger the cost to the economy and vice versa. Second, at the outset of the disaster, policymakers are coping with enormous uncertainty. Early responses tend to be timid and off-target. Sweeping action is delayed by political disagreement. Disasters often create permanent changes to habits, and the most affected industries and regions can take many years to recover. New Orleans still isn't back to its pre-Hurricane Katrina level. The more short-term economic pain Americans are willing to endure, the more lives that they will save. The U.S. economy bounced back from the 9/11 attacks because of aggressive policy responses. People adjusted to heightened security. Airline traffic and demand for New York office space returned to pre-attack levels in just a few years. Okay, it's from the Wall Street Journal. Here's Bill Maher.
To me. Can I ask about the economy? Because this economy is going pretty well. We have to, what? Why is that funny?
It is going well for now.
For now, right. That's my, thank you. That's my question. Is like, I feel like the bottom has to fall out at some point. And by the way, I'm hoping for it because I think one way you get rid of Trump is a crashing economy. Yeah. So please bring on the recession. Yeah. Sorry if that hurts people, but it's either root for a recession or you lose your democracy.
Okay, that's Bill Maher. And what's Ron Paul's response to the coronavirus? Is the Ron
Hello,
Paul
everybody,
Liberty
and
Report.
thank you for tuning in to the weekly report. The coronavirus hoax. Governments love crises because when the people are fearful, they are more willing to give up freedoms for promises that the government will take care of them. After 9/11, for example, Americans accepted the near total destruction of their civil liberties in the Patriot Act's hollow promises of security. It is ironic to see the same Democrats who tried to impeach President Trump last month for abuse of power demanding that the administration grab more power and authority in the name of fighting a virus that thus far has killed less than 100 Americans. Declaring a pandemic emergency on Friday, President Trump now claims the power to quarantine individuals suspected of being infected by the virus, and as Politico writes, stop and seize any plane, train, or automobile to stymie the spread of contagious disease. He can even call out the military to cordon off a U.S. city or state.
Okay, that's enough from Ron Paul. All right, let's go back to this lecture, Predisposed.
I mean, we love to be affirmed, and we love, if we're liberals, we love to hear about how terrible conservatives are. If we're conservatives, we love to hear how terrible liberals are. So we're swimming against the stream here. As an aside, I remember when one of our studies received some attention in the press, we received a lot of email correspondence, a lot of it not very nice, but the one that stuck in my mind was from a lady who simply said, "Don't do this to me. I need to hate conservatives." And I mean, we kind of did what you did, but then we thought about it a little afterwards, and we said, you know, it's a bit unfortunate, right, that we are cut out that way, but that's such a common human tendency. And that, I mean, what's really unfortunate, of course, is that Coulter and Franken sell millions of books, and we don't sell that many books. So that's really what it's all about here. So whether people gravitate toward innovation and reform or security and order is buried deep in their biology. As a result of this, political institutions should focus less on deliberation and more on compromise. Now, that sounds like a kind of horrible thing to say in a way, that we should focus less on deliberation. And I don't mean that entirely. Clearly, there are some people who can be persuaded. A lot of people don't have these predispositions I've been describing tonight. They're in the middle. They're uncertain. They haven't thought about issues a lot. So those are.
Let's get a message of hope and renewal from Madonna in this difficult time.
Go, let's go eat some fried fish, fried fish. Come on, Vogue, I mean go. Let's go eat some fried fish, fried fish. 'Cause there's no more pasta, oh no. So we're gonna eat some fried fish, fried fish, yeah.
Yeah, she still got it. Can't deny. And let's go to President Trump here.
Get back to reporting.
Follow up. Nearly 200 dead. What do you say the Americans were scared, though? I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. Go ahead. I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism And the same with NBC and Comcast. I don't call it Comcast. I call it Comcast. Let me just for whom you work. Let me just tell you something. That's really bad reporting. And you ought to get back to reporting instead of sensationalism. Let's see if it works. It might and it might not. I happen to feel good about it, but who knows? I've been right a lot. Let's see what happens, John.
Let's follow up.
John,
Nearly
go
200
ahead.
dead. What do you say the Americans were scared, though? I guess nearly.
Okay, so there was a good article in the New York Times this week. Complacency, not panic, is the real danger. So you do hear often in times of crisis that panic is the very worst response. But this article points out that in times of crisis, most people don't panic. They're rather complacent. Only a small minority of people panic under threat. Far more don't take the threat seriously enough. The sight of empty grocery shelves, widely shared on social media, combined with the dread of an invisible threat, seems a perfect recipe for widespread hysteria. So far, there's little evidence of widespread panic. Research into decision-making under threat suggests concerns about looming mass panic are badly misplaced. What we find instead, there are large differences between individuals and how they respond to threats like this. Everybody tends to overreact at the beginning, but then most people decide this won't happen to me. Minority of people, about 10 to 30%, depending on the situation, continue to overestimate the risk and behave more hysterically or overreact. These are the people who are causing much of the rush on supplies like toilet paper and emptying the shelves. But this is a minority. Most people have the opposite problem. They are complacent. People will self-isolate for a time, and then when nothing happens to them, when they don't get sick, they will begin to go out again, take more risks. You let people decide for themselves how to react, you'll see a majority taking progressively more risks with time and a small minority exhibiting panic-like behaviors. Okay, back to Predisposed. Liberals, conservatives.
Those are people who are in play, and we can try to persuade them. But I would caution against really trying to sit down and convert somebody who's firmly on the other side. I mean, that just rarely does much good. They're not going to break down in the kind of Perry Mason style with their head in their hands and say, oh my God, you're right. I've been wrong all these years. So I think instead we need to just say, look, we need to compromise with you. I think you're wrong. It's not that we're going to talk until you kind of convince me that you're half right and I'm half right. Instead, we just say, I don't see the world the way you do, but we're going to have to compromise. And I actually think that's really essential. And we're not doing nearly enough of it in the country today. Recognizing the biological basis of political beliefs could make each side more tolerant of the other. And to do that, I'm going to try to give you a little test. I'm going to show you a video clip of Wayne LaPierre, who is the Executive Vice President of the National Rifle Association. Some of you may have seen this clip. It's about 30 seconds long. He's giving a talk to CPAC, which he did, I think, last April. What I'd like you to do as you watch it is to just think. You know, some of you might think that Wayne LaPierre is, oh wait, do I have this on the next slide? No, I don't. Yeah, okay, that he's paranoid. Some of you will think that, and some of you will think it makes a lot of sense. He's right, that it's a dangerous world. My suggestion to you is that the division on that point really has to do with these biological tendencies. And that if you would understand, and as I say, a lot of people think LaPierre is simply paranoid, but recognize that these things are very real to him. Somebody suggested to me that he's just saying those things because, you know, he gets a lot of money from being the big executive at the NRA. I don't believe that for a second. I mean, he feels this, and I think you can see this in the videotape, that this runs deep. And the same thing does on the other side. You know, a lot of liberals, conservatives love to say liberals just don't get it. And at one level they don't, because for liberals there's nothing to get. It's not that dangerous a world. We don't have to worry about this all the time. You know, I think it's that bridge that we need to divide, or sorry, need to connect. Sorry, yeah, there I go. That's a sheer indication I've gone on too long. So yeah, I'm going to show you the LaPierre clip, and you practice on being understanding either of him or of those people who don't think he's right at all.
We know in the world that surrounds us, there are terrorists and there are home invaders drug cartels, carjackers, knockout gamers, and rapers, and haters, and campus killers, airport killers, shopping mall killers, and killers who scheme to destroy our country with massive storms of violence against our power grids or vicious waves of chemicals or disease that could collapse our society that sustains us all.
Jon Stewart showed that once, and when the camera cut back to him, he was hiding behind the podium. But the point is, people, those of you who are liberal, you have to understand that he feels the world differently than you do. And those of you who are conservative need to recognize that some people simply don't have the same kinds of level of concerns that are expressed here. Thank you very much.
Okay, a good discussion there on predisposed liberals, conservatives, and the biology of political differences. Have a look at Wall Street right now, down 2.5%. New York Times right now. New York is told to stay indoors and to shutter most businesses. U.S. announces borders with Mexico and Canada will be closed. New York Governor Andrew Cuomo says New York now bans any non-essential gatherings of any size for any reason. The deadline for filing taxes in the United States has been extended to July. Cases in New York State now top 7,800. Trump resists pressure to force companies to make coronavirus supplies. All 40 million Californians ordered to stay in except for essential workers. Coronavirus stimulus package spurs a lobbying gold rush. State of Washington is engaged in grim discussions to determine which dying patients will get priority. Grocery stores have been deemed essential businesses, meaning their employees are worried about being exposed to the coronavirus. Here's a heart-rending story. A mother skips meals so her children can eat. You can eat a good meal for 50 cents worth of oatmeal. This is absurd. Okay, young adults come to grips with coronavirus health risks. It can be a serious disease for younger people. Many millennials have chronic physical and mental health conditions. Young adults are generally more resilient than older people, but an increase in chronic health conditions among millennials in their 20s and 30s has made them less hardy than they might think. They have rising levels of obesity and type 2 diabetes and high blood pressure, as well as an increase in heart disease and some cancers. These are comorbidities all strongly associated with poor outcomes from coronavirus infection. Some 17% of men and 12% of women aged 18 to 44 smoke cigarettes. Another 4 to 7% use e-cigarettes, which apparently increase the risk of respiratory illness. Millennials have higher rates of behavioral health problems like depression. Significant number have alcohol and substance abuse problems, which can be exacerbated and aggravated by social and economic turmoil and dislocation. Many millennials juggle several jobs in the gig economy. They're more likely than any other age group to be uninsured for health care. Many are also burdened by student debt and contend with increasingly unaffordable housing. As a generation, they have borne the brunt of drug overdose deaths. Many have postponed marriage and started a family for financial reasons. Okay, let's talk more about the biological differences between liberals and conservatives. Here we go.
Who thinks liberal and conservative brains are different, coming up on the Dennis Prager Show. Hello, everybody. You're listening to the Dennis Prager Show. I have a professor of political science at Rice University on. He is one of 3 authors of a book, and it is titled Predisposed. And the subtitle is Liberals, Conservatives, and the Biology of Political Differences. It's a risky theme, so we'll find out what the 3 professors have, but we're speaking to one of the 3, John Alford. Professor Alford, welcome to the Dennis Prager Show.
Thank you. Glad to be with you.
I appreciate that. isn't that a risky thing that you undertook to argue that there are biological bases for political positions?
Well, I think it could be taken that way, but I think we're at a less risky position than we might have been 10 or 15 years ago, simply because there's so much new empirical information that backs up that point of view, coming from a variety of countries and a variety of different types of studies. So I think we've always had some speculation going, obviously, way back in our social and political history about how much of our differences were natural and how much were simply environmental or intellectual. But I think we have a fairly good set of research now to suggest that there's room at the table for part of our political orientation to be rooted in biology.
The problem that I have, and you may well address it, and forgive me for not having fully read it, but it's obviously not possible for a talk show host who has authors on regularly. So I tell that to authors so that they understand. So, but in that sense, I'm where the audience is, and we're learning about the book through the author. So one challenge would seem to me to be that we have to agree with you on what is liberal and conservative. For example, what would you call Stalin?
I think I would say I agree that one of the main issues is that we often have very time-bound notions of what might be liberal or conservative, or individuals. I think libertarians are a good example. In many ways, libertarians seem quite liberal, in other ways quite conservative. And we're not trying to address the sort of narrower, more particularistic individual examples, but really trying to get at a kind of continuum from left to right on particular types of issues that most people would recognize. So I think you can have individuals and you can have political systems that begin at one place and end at another, and that are difficult to classify simply. But I think the important thing to recognize is the reverse of that as many odd or difficult to categorize examples as we may have, I think we have a sense that in politics, as in art, as in views about the proper arrangement of a family, that sort of throughout history and across places we recognize a kind of a conservatism or being slightly more to the right in something like Sparta, and slightly more to the left in something like Athens, and even in your example of Stalin, it's hard not to see that whatever Stalin might have been, he probably was not as far to the left as Trotsky, for instance. So I think it's not that this is that we're providing a hard classification for right and left.
Right. So then that's fine. I'll take that. Soviet studies was my field, and I'll say that in theory, Trotsky was to the left of Stalin, but it didn't matter because Trotsky supported the killing of opponents as much as Stalin did. He just may not have done it as much had he been in power, but we'll never know that. But so then, all right, then is Trotsky, if you will, at the end of your liberal spectrum?
Well, of course, we don't have access to, in our lab, to Trotsky and Stalin, although that would be a fascinating study. But I think the more general idea is that we're in dealing with the general public. I think that we're...
Okay. All right, so we'll deal with the general American public when we come back after the break, and you'll tell us what your research has found. I have on a professor of political science at Rice, John Alford. He is the co-author with two other professors of Predisposed, Liberals, Conservatives, and the Biology of Political Differences. I'm Dennis Prager. Hello, everybody. Welcome back. I'm Dennis Prager. I have a professor of political science at Rice University, John Alford. He is one of three professors who have co-authored this book, Predisposed. The subtitle is Liberals, Conservatives, and the Biology of Political Differences. And they try to find the differences among people within biology as well as within nurture. I take it that you grant that there is a nurture element, or do you believe it's entirely biological?
Oh, it's definitely, I think more than just a combination of nature and nurture, which kind of everyone recognizes these days. I think there also is a substantial role for free will. So we're not trying to reduce political differences to biology, but we're also not happy with political differences being reduced to simply free will or simply nurture. I often think of, as a parent, I often think of parents and the experience of raising children. And one of the things that often happens to liberal parents or conservative parents is that they raise a family and there's a black sheep of the family. And so if you're a conservative couple and one of your children ends up as an adult being a liberal, you sometimes have to ask yourself, where did we go wrong? And I think this can be a good answer to that question, which is that clearly the child was raised, as were your other children, in an environment that was conservative, in which you taught them important things about the values you cherish. And they may have even grown up in a time in which it seemed obvious, something like the threat of 9/11, that it seemed obvious that there were real importances to traditional values. But nonetheless, there it is, one of your children, and you think, how did we fail this particular child? Is it because they were the youngest child and we spoiled them, or should we never have sent them off to the University of California? What happened to that child? And I think one of the answers is that nurture is important and free will is important, but that your children are also biological creatures, and just as one of your children may be outgoing and the other a little more introverted.
All right, so let's take the probably the best known, or certainly one of the best known differences between liberal and conservative. So a conservative believes that the human fetus has value, and the liberal does not believe that. How is that comport with the brain?
Well, I think I'm not sure that the best way to examine this is to take a particular issue at a moment in time and talk about where you end up on that specific issue. But I think if you take an issue and think about why at any particular time people might be on different ends of that issue, I think you certainly see things that emerge there that allow that position to be placed with other kinds of issues. So certainly the notion that individuals ought to sort of the actions have consequences and that personal responsibility is very important, I think figures into that, in addition to notions about sanctity of life. And I think those are important parts of what creates the cultural debate over exactly how to treat that. I think it's probably driven less by the sort of relative degree of maybe emotional concern for individuals than it is about issues that are more deeply rooted in things like personal responsibility.
So the people who believe in personal responsibility would be the ones who believe in which? It seems to me that if you believe in personal responsibility, you could fall on either side of the abortion debate.
Well, I think that if you think about something like criminal behavior, for example, the tendency to be, if we think about what the historical liberal side has been, it's a tendency to think of criminal behavior as being environmentally produced and therefore not really an individual's fault. And
all right, that would be the liberal position.
Right. So a liberal position might say, well, we need to basically reform this individual, provide them with something good to do and a better lifestyle and everything we find. And a conservative position is much more likely to say this is a personal choice, right? It's an act of
right. That's fair.
And
okay.
we should be more retributive.
And you have found brain differences between those who have. I assume that would hold true for capital punishment as well. Is that fair? Is that in your book?
It would hold true for something like capital punishment, and I think it's a nice example of how things can change over time. So if you think about the liberal position on capital punishment a few hundred years ago in Britain, for example, might have been that you don't use capital punishment for, say, minor theft if the person involved is under 12. So it's hardly something we recognize today as a liberal position. But the relative position, right? So in that kind of situation, someone with a conservative bent would favor whatever the currently cultural definition of a more retributive approach would be, and a person with a more liberal bent would favor what might in the perspective of history seem like a very draconian punishment, but at the time was a relatively less retributive.
Right, and you have found brains are different?
Well, I think one of the nicest examples of the sort of physiological finding is dealing with perception of threat. So conservatives are physiologically respond much more quickly and much more dramatically to threat, even if the threat is something as abstract as a burst of white noise, a startle. The startle response of conservatives is much stronger. Conservatives are much more responsive to and attentive to threatening pictures, for example.
Okay, interesting discussion there on the 2014 book Predisposed on the biological basis for political differences. Okay, looking at Wall Street right now, it's down 713 points, so over 3.5%. And crude oil is down 21% to less than $20 a barrel. Jack Schaefer tweets, how did Andrew Cuomo become president? Well, Joe Biden got sick, was in the ICU. Bernie Sanders couldn't stop swearing. So the Dems nominated Andrew Cuomo at their virtual convention. Based on the morning show he had been running to such great acclaim, then he ran against Trump. So Andrew Cuomo has been doing very well. He has performed impressively as he confronts the media every day, giving updates on New York's response to the coronavirus. And what's on top of the Los Angeles Times right now, Trump halts most traffic on U.S.-Mexico border. 1,063 confirmed cases in California, 20 deaths. There's a new outbreak in San Diego. And California's closed all non-essential businesses. Employees told to work from home. Right.
Than liberals. Liberals really don't physiologically respond much differently to the picture of a snake than they do to the picture of a rabbit, whereas conservatives both attend quickly to the picture of the snake and respond much more viscerally to it. So I think about that as just one of many physiological differences that might underlie conservatism.
Yeah, the problem, no, I don't deny one moment the research on the snake-rabbit difference, and I find it actually intriguing that somebody would have an identical reaction to a rabbit as to a snake.
It does fit with a kind of stereotype that conservatives have of liberals.
Well, it does.
Don't get it.
Yes, that's right. They don't know who snakes are. They think snakes are rabbits. I buy it, frankly. That's right.
It's Obama saying we're going to Cuba, right? We're going to Cuba because we don't know that Castro is an enemy, right? And so maybe it takes liberals a few minutes to work that out.
That's fascinating. We'll be back in a moment. Final segment coming up. You're listening to the Dennis Prager Show, final segment. And I want to make this clear to my listeners as well as to the professor, but especially to my listeners. The professor and I may differ in certain cases on what characteristics are liberal or conservative, but I don't deny that the way the brain is formed may be one of a constellation of factors in why people think a certain way. I have said often, Professor, and I suspect you being a professor have the opposite view of me on this, but I have said often, I think there is an unbridgeable gulf on the capital punishment issue. Every fiber in my body thinks that it's a cosmic injustice to allow all murderers to live out their lives, and others believe that it's a cosmic injustice to take any murderer's life, no matter how heinous, torturous the crime and how many people were murdered. And no talking matters. It's truly as if we do think differently.
I think you're exactly right, and I think you hit on a very important example of something that I believe is the most useful outcome of reading a book like ours that tries to look at this in an impartial way, where we're not trying to beat up on conservatives or liberals, but we're also importantly not trying to suggest, as I think too many people do, that in the right environment or with the right appeal, liberals and conservatives could come to see the world in the same way. I think that's a mistake. I think you're absolutely right that people who are deeply liberal and deeply conservative, people who feel it in their, possibly even in their DNA, see the world differently, feel the world in viscerally different ways, and think very differently about the world. And you're not going to bridge that. The best you can hope for is some acceptance that the other person's view is not one you will ever accept, but a recognition that it doesn't come simply from their ignorance or their foolishness or bad parenting, but maybe comes from the fact that they are just wired up differently than you, as left-handed and right-handed people are wired up differently. But we're once thought to be just left-handers were once thought to just be stubborn people who refuse.
Is that why you wrote the
truth.
book, in order to have each side accept that of the other?
Absolutely, to accept both that that others are different, and also to accept that we won't change that. So we need to stop thinking we'll all come together in the middle.
Well, that's why the motto of my show is I prefer clarity to agreement. Let's understand where we differ.
I think we have here maybe a moment of both clarity and agreement.
Well, that's very nice. Sir, it's...
Okay, that's John Alford, one of the three authors of Predisposed, the biological basis for political differences. Here's an excerpt from the book. Liberals and conservatives are reluctant often to accept that their differences are rooted in psychology, let alone biology. Their own political beliefs just seem so sensible, so rational, and so correct. They have difficulty believing that other people, if given full information and protected from nefarious and artificial influences, would arrive at different beliefs. Liberals are convinced the existence of conservatives can be written off to Karl Rove's treachery, the Koch brothers' fortune, the bromides of Fox News, and a puzzling proclivity to think simplistically. Conservatives are equally convinced the existence of liberals is attributable to the lamestream media, indoctrination by socialist university professors, the sway of Hollywood, and a maddening tendency to disengage from the real world. Their political differences are grounded not in a duplicitous conspiracy or an irrational disregard of logic and truth, but rather in variations in our core beings. Conservatives are not duped liberals, and liberals are not lazily uninformed conservatives. And that would do it